lot of things we can add back to what we're helping on. The journey has been a very interesting one for us. We started this in 2009, and we decided to start advocating for children with disabilities. And it's grown into we're all here today. And aside the two-day conference, we would have the consultation program, which will hold this year at University of June. Are fully at this point for your child. Wait for another to so today we're going to have the plenary sessions in the morning, and we'll then have the breakout sessions. I'm sure everybody has a copy of the brochure you can go through, so you can look at what class you might be interested in attending once we once we're done with the plenary session. So thank you and welcome. Now I'd like to introduce the gentleman that has made all of this happen. He's been extremely supportive. This is a cause that is very close to our hearts in Gtbank. And just join me in welcoming Mr. Segun Agbaje, Managing Director of Guarantee Trust Bank.
Everything we had a lot. I think we started to brought people to talk about education, important social thing we do that we give back to society. So I hope again that I will learn something new this time around, that you will learn something new, and that we can create a really special, productive life for children with autism who are truly just special, gifted kids, really. But you need to find out what that gift is. So thank you very much and enjoy the next couple of days.
Thank you for the. We started in 2011. We had the partnership with Blazing Trails International. They're consultants. On this journey, we strengthen that is 5-year review. Good morning.
Review. Together, home-based community rehabilitation service, training and education. We don't want people to know that we have somebody in our family like this, because nobody will marry the other siblings, and these are some of the stories that I have heard along. They look different, normal. Child's behavior. We have autistic disorder. Million by the other places, and an awareness has been created by Gtbank and Blazing Trails to address the prevailing lack of understanding for autism. And now, as of 2013, we have the College of Medicine as one of our partners. And the history of our program is listed in the book, but I'll just review some of it. That in 2010, we submitted some information to Gtbank, and then subsequently we were invited to develop our first program, which was in 2011. And then people said, well, why do you need to do that? Well, once you do a review of literature, you'll discover there aren't that many programs, there aren't that many research papers written on disabilities on the continent of Africa. And when you do the research, you only come up with 12 or 13 papers that address disabilities in Africa. And there is an epidemiology need. Studies are required to define the magnitude of the problem here on the continent. And so this is some of the work that we're trying to do to define what it looks like, what it might look like in the future, so that we can put things in place to help these children as they grow. So the goals of our autism spectrum disorder program is to ensure that autism is diagnosed early in children, to ensure that children living with autism are not stigmatized and that they receive the required support from parents, teachers, friends, and the society at large, to encourage institutions and the government to fund autism research and its management, to highlight the problems concerning autism spectrum disorders and change the public perception, to reawaken society's consciousness and educate people on consideration, development, and protection. Episode. The partners, as you group with for our saw that we needed a bigger venue. We went from there to the BC from a week to 2 weeks. So as you can see, we are making headway and providing an opportunity for parents to come, and let's see if we can get some intervention started with the children with disabilities. This is from 2004. This is our collaboration. I'm sorry. Therapists and we play innovations with them chatting at the and transforming lives, and the ideal behind this theme is to look at improving or in some way cases creating systems and policies that affect care. Last year, the foundation has been developed through the Gtbank on a resource center dedicated again and again. We 2013 presentation Blazing Trails 14 Dr. And in 2000 at the Internet research were from medicine. Picture of at that places are what we've been years, where you have opportunity in order to make funding and to home for here in Nigeria. We're also some ethical to make this feasible, viable. Attention at this to constraints of the installment action and sticks on it happens brand flu report on that tomorrow when she does her presentation. Our study has been limited by geography. Patients come from all over the country to visit our clinic here, but the need has been that we need to move around so that we can see more people. Our findings have been limited to patients seen through this program, and our consultations or behavior clinic needs to be replicated perhaps quarterly, or at least more than once a year, but have not done for a number of reasons. And the resource center should be available for the Nigerian people. Intervention. Our objectives were made, make it easy for participants to come to the location, to complete questionnaires, to help the consultants better evaluate them, and incorporate new ideas into the existing routines. Now, what we want to do, we want to make more presentations at international conferences. We want to push for governmental legislation and have it implemented. We want to develop more vocational awareness for adolescent youth with other developmental and this model and branch out to Nigeria and then Africa. You have a and can you bring the microphone? Okay. While we are waiting for someone to ask us a question, I'd like to introduce our international team of experts. We have Dr. Diola Fayemi, who's Managing Director for Diversity and Inclusion at Auburn University in Auburn, Alabama. We have Dr. Marcus DeQuincy Tillery, who is, this is his, Diola has been with us for 5 this is his trip to Nigeria program. Riverside Baptist Church in New York, a megachurch, and also Princeton School of Divinity. We have Dr. Lawrence Sutton. This is his 4th year with us. He is a board-certified psychologist and has been primarily a writer of programs and intervention. We have Mr. Olayinka Lemikandra. That's my small boy. We have Dr. Sonia Armstrong. This is her 5th year and part of the original team with Dr. Fayemi from West Virginia and a Fulbright scholar. She will be going to Slovakia, January 2016. We have Dr. Ruth Brand Flew from Birmingham, England, and this is her 2nd year with our program. We have our new addition, Mrs. Denise, who's a speech therapist from Chicago Public School System. She just retired. We have Mr. Ade from State. He is a board-certified speech pathologist. We have Mr. Darren Microsoft and Infused Strategies. We have Mrs. board-certified occupational therapist from Frisco City Public School, who's on in the doctorate is wine and
question. It's being developed with what we have is using the national curriculum of education and putting it into then curriculum from so I you know curriculum living with will.
But I think for the needs of the people with disabilities, that teachers need to be trained to do more inclusion. And I think the curriculum is good, but I think the piece that my opinion is that
I actually followed through your presentation on the 5 years review. Something I did missing was your collaboration with the Federal Ministry of Education. Our cross so that and also be secondary ownership in Nigeria.
have some to bring schools along abilities in that perhaps question. And we can do that because we'd like to have it here in Nigeria that you can earn a degree or a certification from a Nigerian school. That's ideal. I mean, I can bring programs out of the country. It means
There have been concerns from stakeholders, passion stakeholders. For the families.
Okay, on your
and it to someone that is very intelligent, kind of support more. It can be done.
Findings from the 2 years of our collaboration, going forward, what the needs are, and I'll be concluding. Looking at children with autistic spectrum disorders and their parents, it's obvious that they carry a huge burden in the absence of a comprehensive in-country platform for timely diagnosis, management, and support. For some of the patients we've seen, they've gone all over. Some of them don't even know where exactly to go, and majority of them were not even diagnosed on time to the extent that they'll be able to achieve or to be able to come in contact with support or those who will be up in management. In Nigeria, the areas of needs or unmet needs are much among these children, and it is huge, such that they have problem with early diagnosis, as I've earlier said, training. The caregivers equally have problems, and they have problems in being able to achieve some level of education. These unmet needs have often necessitated many, those who can afford it, I mean the wealthy ones, to be able to travel abroad, looking for being able to attend less helpless. He has helped the this autistic awareness. The bit of it, director of the collaboration with medicine. This initiative brought coaches. There are other there are jingle, there's been like sessions with who are coming autism awareness the children fight to organizing. There's been seminars. Today we are going with broad stakeholders' participation, not only to create awareness, but also to attempt to define the way forward and how parents can cope with and manage the challenges of autism. This is a schematic representation of our collaboration. Actually, there should be another arrow linking College of Medicine to Blazing Trail, because over time, we've had to collaborate with Gtbank through the Corporate Social Responsibility Unit, the Blazing Trail, and all what we offer is screening. And we're hopeful that later there will be a resource center. We've heard about the 2 rooms that have been given to autism program by the College of Medicine, but we're still hopeful that there will be a resource center where there will be clinical care, research, and training. About the College of Medicine, it's important for us to have a brief understanding. It was developed or was established in 1962, and it has a mandate capacity of health workers from different faculties, different departments who are able to take care of this set of children. For example, the pediatricians, the internal physicians, we have the psychiatrists, and also with the collaboration with the university, because the College of Medicine does not stand on its own. It's linked and affiliated to the University of Lagos. We have other specialists in the area of special education, occupational therapy, and all sorts. And is equally attached to the tertiary hospital, that is the Lagos University Teaching Hospital, with a functional ethical research committee. And that is also shows the College of Medicine patients. In 2013, we identified about 70 children that had neurodevelopmental disorders that were present for the consultation. More would be children for the consultation. Five children on radios see that 20 givers that were 2% of them identify stakeholders. These are very childhood development complaints or a equally issues of the children in a child criteria of autism and childhood disintegration disorder in the range. Of the parents and average instruments are to they identify that distress psychiatric burden as late as 28 years. Then considerable number of children, considerable number of caregivers have caregiving related burden and distress. If you recollect, I made mention of 15% and I think about 34%. So specifically, emotional distress was about 2-fold and 10-fold increase when they were with mothers who are with given as a it's then and certain ask herself what from a little been able to beyond the last year before these are where we develop every month to discuss parents and other share their views. Others who have had the presentation same was produced and kudos that countries are late GTB support group will be full. Not being to that's the essence I talk collaboration medicine and the university center see how the outreach and open to thank City of Lagos the Lagos the college the corporate social blazing through university teaching us with the others.
She will come and just ideas and everyday challenge.
I think they are doing a very wonderful job. They are not paid to do this year in, year out, every day. You need to see what they go through caring for these children. And having had experiences talking with them, meeting every month, there's a lot of problems of these things and the things we've been able to do over the last 18 months. So, about support groups generally. It's not something that is very common in this environment, and I'm sure some people are wondering, what are support groups? Support groups are groups that comprise members who share similar issues, and they come together to share coping strategies so that they are able to feel more empowered and have a sense of community and offer to others with help and non-material share more identify to the group. Self-help groups about this for people. Examples of support groups, people who have problems, and they have been for training professional. It's almost every online now. Support group online for people maybe they don't want to be seen, they don't want their faces to be known, but they can talk openly on virtual platforms. So what are the few or known benefits of support groups generally? It helps people to feel less alone and better understood. It empowers caregivers to work to solve their own problems. When you come together, you sit with other people, you learn to solve your own problems. They also serve as forum or fora where people share information and keep one another up to date on news of interest to them. They offer unique emotional identification that is different from what professionals can give. When professionals are talking, it's easy for you to look at the professional and say, after all, you don't experience what I'm going through. But when you sit in a group where you listen to several other people who know where the shoe actually pinches, then you're able to learn and identify with them. They also serve as a safe place where people who need to talk about intensely disturbing issues, personal issues and experiences can do what we call catharsis. They can ventilate, and they are sure that other people there would understand what they are going through. Additionally, members feel equal. I mean, you all go through the same thing. So there's this sense of equality. Nobody is bigger than the other. And that's another benefit that support groups offer. And lastly, support groups also help to reduce anxiety. I mean, as a psychiatrist, we know what, I just used the big word before, catharsis. When you ventilate, your anxiety level comes down. You're able to do better on the whole. And it also improves people's self-esteem and gives members a sense of well-being. So that's a background on what support groups tend to offer. So what is our own story, and why did we start this support group? So we were at the Child and Adolescent Mental Health Clinic in Louth on a very sunny afternoon, and there was this mother who brought her son for consultation. And then she came in, her son had autism, but he also had comorbid ADHD, that's hyperactivity disorder, severe one. And it was all over the place, running up and down. In fact, he ran out of the clinic, and the carer that came with the mother had to follow him. And she broke down and started crying. She started weeping. And she asked us several questions. She said, "You people should help me now. How do I get an affordable school for him?" This was someone who was working in a bank before. She was a top executive. Unfortunately, she lost her job. She had enrolled him in a private school before. He was doing quite well. But after she lost her job, she just couldn't afford it anymore. And that was the question. How do I get an affordable school? And the final question she asked was, am I in this alone? Are there other people who are working through this same situation? And this just struck a thought in us that we need to start bringing parents or caregivers together to share so that they'll have a platform where they can onboarding themselves. And that was how we started. And so we started meeting. We meet every month at number 6 Harvey Road, Yaba, at the Department of Psychiatry. It's just behind the Federal Neuropsychiatry Hospital there at Yaba. We meet every second Wednesday of the month. If we are unable to meet on second Wednesdays, we meet on third Wednesday. And our meeting time is 3 p.m. Membership is open to all family caregivers of children with autism and other neurodevelopmental disorders. It is not just for children with autism, because we know these children share similar challenges. They have similar needs. They have problems with speech and language. They have problems with repetitive and stereotypic behaviors. They have problems with challenging behaviors. So we've been able to identify anytime. Non-religious. Of the level of along explain to them English and very useful. Object can experience as well as the support of what they are give us deal with us do. Like I said before, to share their experience, able to talk, and then for as doctors and people pass through when his child was 4 years, and Mrs. B can learn from that. So that is one of the things that this group helps to do. Additionally, they are able to get information about the available resources in the community. They come, they ask us questions. How do I get a speech therapist? How do I get a school, an affordable school? How am I able to link up with an occupational therapist? But someone in the group may have used a speech therapist before. Oh, this person is quite good, and so they're able to exchange ideas. The group has been able to identify common challenges that parents or caregivers of children. We use caregivers because it's not only parents who take care of these children. We have grandmothers, we have fathers alone, we have aunts, we've seen aunts, and we have neighbors who take up the care of these children and when they see that there's a need around them. And so there are common areas of challenges for caregivers of children with autism and other neurodevelopmental disorders. In the areas of education, speech and communication, challenging behaviors, potty training. I mean, those who have passed through this stage know how it is for typical children. And it can be much more challenging for children who have intellectual disability. How to make them achieve independence. Caregiver burnout or strain, very common among this group. And this is very important. It's something we don't think about, but I get asked all the time, Doctor, will my child ever get married? And it is a burning question on the mind of most parents of children with autism. So what are the topics that we've been able to discuss so far in our meetings? We've talked about the connection between autism and spirituality, knowing that we're a deeply spiritual and religious country where people attribute things that they do not understand to spiritual problems. We talk about caregiver strain and how people can cope. We talk about diet. What is the effect of diet on children with autism or other special needs? Sexuality. In fact, we had to run this particular topic for 2 months or so because there were so many areas to talk about. And I was particularly impressed with some of our mothers. There was this particular mother who was able to share how she relating with her more than 6 months, consistent every weekend together education. Son who has a special need. And this, she said he would leave. She felt a nation in this, but he noticed had changed the exercise book. I don't know if some of us who are used to this coloring, are you able to identify areas to touch for children, areas of abuse where not to allow anybody to touch. And the son excitedly came to her. It doesn't use language at all. But he came excitedly and went to pick up the book, which she said had become torn, and she could even hardly see what was there. And he was pointing to his crotch area. And he showed her the picture of a male that showed pubic hair, that he could see his own. And she said that day she was so excited that so all this while, this boy was actually listening. So this is a pointer to some of us who think that they don't understand. They do, especially when information is passed appropriately and when this information is passed on consistently. You'll be amazed at how much they know. And what was much more amazing about this was that it came from another parent, not what a doctor taught this parent. So you can see how this gives a sense of community and how they're able to share the problems together. We talk about available educational programs, potty training, and how to discipline. You can't take discipline from an African parent. And so parents were really excited. Some who had little children were wondering, can I discipline my child? And they were able to learn from parents whose children were much more older. And then how to plan for their future. Again, this is another area that I found very, very interesting and encouraging. There is a parent whose child has autism. She's married to a lawyer. She's a microbiologist. And she came and she was able to tell other parents the plans she and her husband had prepared for their child in the case of eventualities. This is not something parents think about, but she was able to share. And it's also good because when doctors or professionals talk about it, one could say, are these people callous? Do you want me to start thinking about will and trust at my age? But coming from a mother, it shows how much they are looking forward to when they will not be around and who would take care of their child. So it's something that I think parents would also need to start looking into. So what are the feedbacks that we've gotten from our members? We've gotten several feedbacks, some of them positive, a lot positive, thankfully, and quite a few that are negative. They say that the group has been able to help them, serves as a place where they've been able to share their experiences without fear. They felt that their issues were being listened to. They learned a lot how to manage their children better. A lot of them found the group interesting and encouraging. It has made them to realize that they are not alone. They are not dealing alone with their issues. Socially, they've been able to make friends. People have been able to visit other people at home and expand their social network. And their knowledge base has increased. Unfortunately, like for anything, you also have to look at some of the negative feedback that we've gotten. Attendance can fluctuate really, really bad. Sometimes, I don't want to say how bad the attendance can be, but we understand it could be the Lagos factor. Sometimes the traffic is horrible, and sometimes it's difficult for people to leave their kids at home. And sometimes we also have people calling after meetings to say, I really wanted to come, but I just couldn't make it. I'm sorry, what went on? And then we're able to relate what went on. And some have said, even though a lot said the meetings have been very interesting for them, a few have said that they found the meeting boring. So, and that has helped us to look at ways in which we can improve. And so how do we take care of these few downsides that we have? We want to improve attendance by organizing seminars. We've had only one so far. They've also clamored for vocational training, knowing that some of these mothers have had to leave their jobs. They don't have anything doing. We have a member who has 3 children with special needs, 1 child with Down syndrome, one with an intellectual is a lot of strain. Ask, what can we do? How something that I can do and what other ask questions. How do we make it inclusive and affordable? That is the question. And I hope the government is listening. A lot of these facilities are owned by private. And it is their the government of those places where children is lack of kind of that some of and child. I was that it would because we have couples to get resources. Community safety. I would assist. You need to look at the overall to know huge strain in finance to achieve intervention. Talk about ours have been clamored. We are going to start or a facility at Lekki. They provided resource people at no cost whatsoever to give in modification. So thank you very much for listening. I hope you enjoy this presentation.
Not how you want to collaborate with other parents. There are many some parents. We've been around 28-year-old to reach group. What time are we?
SMS every month. We have an SMS bank. We have a contact list that we got from the previous attendees of this screening program. Contact from about the top
or children with this. We are, well, the foundation caters for children with all the different types of challenges, and we go into advocacy. We also have self-help groups for parents, like we call it Parent Forum. We do trainings, and all of these are quite a lot. I think we would like to know if there is anything you can offer us, because as I speak, we are planning an outreach at Ahoda in Rivers State. We go into communities to reach out to parents, and when we have we identify those conditions. We have meetings with parents, so we have parents forum in all the communities we have met, and then central train. You are just our mind capacity to know the way we can get organization and from children face. We let them child when he went to school, and I think a forum like this is good to tell, but at the time, if and that is into this to them and not cancer says for all can be much what this facility this support.
And well done. Thing. Just that some resources, in-house resources that we can reach out to. We do from the hospital community has shown to operate with us. People, maybe we'll
from who are 88% on sir. Are here now at our
listen to Mr. Pupola.
That's why I said underage organizing committee that what can we do? Because if you want to confuse them, you must speak their language because they are not educated enough. Where they are coming from does not. They are men.
Thank you. It was on the radio, on the TV. Let's speak in Yoruba. Let's speak in Pidgin. Let's issue. So also organize something together.
And what Nigeria support been easy children. Even when they are doing well, they will tell me, sorry, I don't want your child in my school. So we need to reach out to schools. You can do a letter, even to the Federal Ministry of Health, for their special education teachers to be involved. Just a simple letter notifying them of your meeting and asking them to send people. Because the information they learn from you, they will take it back to schools to help our children. And then there are wonderful centers who do a lot of things individually. This is time for them to come together because, like you said, anybody can enroll. So if the centers are involved, they can now encourage their parents to bring their children or to come for the meetings. That's where you get a large number of people. And apart from that, the one we had more than 200 people present because we involved the centers. And not only involving them, you make them as stakeholders. They were given topics to discuss from different and had a stakeholder that come in groups, schools for people to come, and that made it more interesting. You also need a lot of finances. It's not easy. You need something to make people to come, and some people donated toys, so parents were made to pick, and certain numbers were called randomly, and they were giving gifts for their children, and that made them very happy. And this support group is very important because you see people shedding tears because they knew they were not alone. It is very, very important. Everybody has to be a stakeholder in this effect. Now, to add to the early diagnosis, so ago, I was in and it was from day that they talking about to go to the ground of health and 15 more forms is very much clinic. Parents with the benefit to thank
for the we collaborate with the pediatricians. In fact, now we have more referrals from the pediatric unit, neurology unit especially when they have children with some of these developmental disorders who have behavioral problems. So they refer them to us for management, and that's what we do. We hope to reach out to more schools. We said we want to also of community group is the kind of we are hoping group, you know, and you don't feel you're in a group of much for all the people can.
I love points when one gets really passionate. It's to ensure we spread the word. We have our www.gtbank.com/autism website. So we can put that in for people to and just that we now would see and
Good morning. I had the opportunity trails. I like that it had developed on the basis that I know the legislation that has been put forth on behalf of intellectual developmental disabilities and the autism community will move forward, that it will be passed, because that speaks to the tenacity of the Nigerian people. And so I will make my suggestions and my policy recommendations based upon the research that we bring forward, but also with the understanding that we will continue to move forward, that the government will recognize the movement of the people and will sanction your voice in terms of that critical legislation. That connect important part have made here. On behalf of developmental disability, speak basis, our brothers, and so we want to embrace from emanate. When we look at the policy affect equality, individual education, and 1.2 million, that we recognize that these are a potentially underserved group in many ways, especially as it is related to the care that they are given, the educational quality that they receive, as it impacts the quality of life, as determined by access to services and access to technology. In terms of care, 2020 report identified our particular population, the intellectually developmental disadvantaged, those of the autism spectrum disorders, as a medically underserved population. So in other words, even with all of the information, the struggles that families go through to make sure that we provide a home base for individuals in the spectrum, there are millions of people with these disabilities that lack adequate health care because of the lack of primary care providers who are properly trained to treat them. Thus, as an underserved group, people with disabilities experience disadvantages in health and well-being compared to the general public. So aside from all of the struggle that we go through in order to care for them individually and provide homes and a sanctity, there is the notion that they are underserved in terms of the medical needs that they may have. In particular, people with intellectual and developmental disabilities remain subject to significant health care disparities. This is not a phenomenon that is indigenous to any particular country. This phenomenon exists in the developed world. We deal with the justice in New York City, food, clothing, but what we have noticed is a continually growing segment of the population that we service that are members, are individuals that are on the spectrum, intellectually, developmentally disadvantaged individuals, and we notice the health disparities that they are subject to and try to develop ways in which we can work with the healthcare provider networks to address some of the disparities, as they have a tremendous impact on the quality of life for individuals that are intellectually, developmentally disadvantaged. These disparities result in poor health in general, including poor health outcomes, higher prevalence of adverse, chronic, and/or secondary conditions, and increased mortality. The idea that we work with and support in the passage of the legislation a continual policy mandate to identify a medically underserved population serves to push not only the stigma that is associated with it, but the infrastructure that is supported by systems and policies that have to address this expanding need. If we continue moving along without addressing the designation of a medically underserved population, we miss the opportunity to drive attention to, across all sectors, the intellectually developmental disadvantaged and those in the autism spectrum of disorders. Education quality. Factors working against the education of autistic individuals. We must be ever mindful in the collection of statistics that they are accurate. We had a statistic reported today, 1.2 million individuals in Nigeria suffering from autism. It is very important that we continue to validate as to serve these individuals will be driven by their consensus and census data. Lack the accurate number as reported be directly related to the services that are provided to this especially vulnerable community. It is important for us in this community pay particular to the development and of these data elements across our communities, especially that again, not just but across the world, especially in the United States, been a stigma in the as we develop does affect lack of a process. the stigmas that have been associated with it, the lack of medically trained in all of our communities, there is a tendency to move toward improper diagnosis and thus the lack of service that these individuals need once they are in the system to move forward and to be guaranteed a quality of life that will drive them into adulthood as productive citizens. Inadequate manpower, as I've talked about before. A lot of the pressure to work with, to develop, to move those with intellectually developmental disorders forward rests with the amount of stress that works. The prevalence that you've already shown, the data that is developed community put funding. A lot of us have do come from the ivory tower. As it impacts these individual legislation about poor teaching practices to bring different at a time, but rather we live in a world where we have to in our class dictate that are put on terms, but they to interest accommodated, and the behavior might be put could be a language of students in the class. Access has been generated helping in autism. The it is applied to high function, no matter where they may be forward, ability to realize and for each other, that language and communication skills, social skills, cognitive skills, organizational skills, etc., are best moved forward with given technologies. Not all technologies will provide for us the progress that we need in all of these categories. And so it's important that when we hear Mr. Daniels and that when we evaluate technology in and of our own needs, that we bear in mind that the technology can be focused toward a particular skill set that we're looking to develop. The types of technology that we employ, alternative and augmentative communicative technologies, for instance, they can increase verbal output. They can enhance and increase verbal output. But again, many times we're looking for technologies that can do more than just focus on one particular area. And so we need to look then at a teaching tool or a strategy for increased independence, for instance, to support academics and literacy, social skills and vocational training, daily living. This is a function of the type of technology that you engage and how you use it, not as a toy, but as a tool, as part of a strategy to move forward. And again, I'm very excited to have, as part of our consulting team, Mr. Darren Daniels. I'm sure he'll spend much more time and share with you much more expertise I can share. But it's just members in the Nigerian community to engage, whether they're low tech, mid tech, or high tech, that can be used across the spectrum to engage individuals forward. And that's in terms of technology. The technology, working there in the way in which you have addressed it already. Technology, other levels, if we're moving from an associate's degree to a bachelor's degree to a master's degree, we can employ this certificate to cover the basic understanding that may be devoid in any particular program at any given level, and thereby extend and broaden the reach of this certificate as it is issued forward. It is our goal to develop a program here on the ground in Nigeria that reflects the tenacity with which you have addressed this issue. It would be a groundbreaking initiative around the world for it to be developed here, because you stand shoulders and heads above many in this community. And so to incorporate your experiences in an online platform that can be delivered anywhere around the world would be an extremely valuable opportunity to move our efforts forward here. Here is an opportunity within this to provide consistent train-the-trainer experiences. It is the basis upon which we train others. And for this particular is being met in order to stay in front of it and drive the resources that we need down to the individuals that and the communities that will benefit from them. It is important that awareness around medically drive intellectual. This awareness is another faith community. Understand we need intellectual and providing for the transition to adulthood that we must focus on as a policy transition that we're able to the quality of life, particularly on here with Blazing Trails with Gtbank to blaze.
Final its presentation, and then we'll then have Q&A at the end. Thank you.
GT. I just want to say, can we just all right at this place? Fantastic, fantastic. Thank you very much. Go ahead and sit down. Thank you very much. Okay, let's see how far I can get from this place. I can actually looks like the sweet about 50 make in not to be here. I will say a few things to go on to states of health and wealth world. About 2,000 webinars, and we the human mind and the human body. Dr. Doris High, OLG, doing a fantastic job over there, and a few other places that are really on the spectrum. You coming? All treatment, medicine, everything from all the batteries here before, but nobody has all. We need the human, how the human mind to do, because that really is where the wisdom is. Okay. Our two goals: to educate and to provide to our and staff patients. Also here. Was there? Yes. Them to listen. We for to hands up, please, if you have heard about biomedicals. Oh my goodness! Wow. Okay. Supplements, more highly concentrated, and scientists nature, they're coming with the body and human. Let's see what across to the aspect of talk about this man I did about war time soldiers were training with broomsticks, yeah, but they had the will to win, they had the will to fight, they had the fighting spirit, as he would put it. And out of that, out of his speeches, we heard some of the greatest speeches in the wartime history. We will never surrender. The stars and their courses foretell the redemption of mankind. I mean, a prime minister talking like that. But he kept on, the point I'm trying to bring here is that he kept on insisting, if you give us the tools, he was pretty much speaking to America, if you give us the tools, we will help you win this war. America didn't want to come into the war at that time, and of course, eventually they did because of Pearl Harbor. But they came in, and Britain and America and the Allies eventually overcame, and there was victory. If they hadn't, this map of the world, of the different countries, would have been very, very different. Hitler would have seen to that. But the point I'm trying to bring here is this. They had the ability, they had the intelligence, they had the training. They lacked the tools. Many times, these kids, their brains, their genetic codes, their digestive systems have the ability to improve. They just lack the tools. And what do you think those tools are? I think, and again, I'm not trying to single. I mean, with stroke damage, therapy improve the matter of whatever. Quotes by one of my favorite people again. He's the one who actually named folic acid. Anybody know what folic acid is? How many of you have kids? How many folic acid doing heal nutrition? It needs that. It does points just found out. Limes, that's lime. Okay, poor attempt. All right, maintain. So, you guys. Limes and lemons have vitamin C, so adding vitamin C to their, just giving it to them. You found them just suddenly waking up from almost at the brink of death, coming back to life. Vitamin C, of course, is very important for collagen formation. Collagen is the structure which holds the tissues in your body. Okay? When we're talking about where if you can increase in your gut, especially if you can begin to heal your gut, the gut of your kids, you will find out that, anybody ever heard about leaky gut syndrome, by the way? Leaky, close up those. I'm not, your body is the material. Gut. Okay. Sorry for them for that. But many times these medications don't work like they should. Why? Why? Come on, guys. Because once you just keep coming back to life, because this all has disorders, others, them a round of applause. Was written by she decided to the bowel disease, and that's excellent. Again, that's why she titled how to ameliorate talk about that. Nutraceuticals basically do this. They act like drugs, but they are not drugs. They are safe. And the whole point is to effect a physical change in the brain and body. And there are three main areas that they work. They work when it comes to the structure of the cells and the tissues and the organs. And they also affect the function, eliminate toxins. Okay. But seem to have of after nutrition they are do have as if large baby isn't there. We are not the treaters. We are not curers. The doctors are the authority. Medical doctors are the authority when it comes to treating kids. So we just work along with them. That's what. Just a brief. Many years we find out the whole. Three is an interest. Surgery. So you need a straight shooters don't do too well in politics, as far as from my experience. I mean, I'm not saying they don't. I'm not saying they are crooked. Everybody's a crooked politician. Please forgive me. But when you have someone that is he's a very vocal and very direct kind of person. Well, like I said, I wish him the very best. Anyway, he began to understand the whole idea of nutrition, and he began to add it and began to speak very, very vocally about the importance of including nutrition in whatever else you're doing. And I worked with him a little bit. That was way back before I gained all the weight. And, as a kid, I had always dreamt about being this, world-famous neurosurgeon that has written many books. Well, I guess right here is pretty much as close as I actually got to actually becoming one. But, man, you guys are a tough crowd, I have to say. Okay, how many do we have left? Okay. The only supplements that I've heard Temple Grandin talk about, how many of you know, please tell me you know who Temple Grandin is. Temple Grandin, everyone. Temple Grandin. Whoa. Okay. Go Google her. Or in Nigeria we say goggle her. Who's the guy that said 98% of us are illiterate? All right. So Google Temple Grandin. She's probably the most famous autistic in the planet. She has a PhD. She's an inventor, a creative person. In her field, she is almost like the #1 authority. So she overcame tremendous odds. But she had a lot of things going in her favor. She had a wonderful mother who understood things. She loved horses, and she grew up on a farm to some degree. She had very strong help, peer group pressure, maybe, peer help around her. Anyway, she's a professor now. She did it a lot. And her main point was, she doesn't talk too much about nutrition, but the main thing she talks about and she mentions is omega-3 fatty acids. Omega-3, what did I say? Omega-3 fatty acids, extremely important. Why? Because your brain, 30% of your brain is actually made up of omega-3 fatty acids. So if there's damage to the brain, it would be foolish. Forgive me if I say so, but now, if you didn't know before, now you do know. You absolutely need omega-3 fatty acids. Everybody does, but children on the spectrum more so, because they are lacking in so many ways. So you absolutely need omega-3 fatty acids. Obviously, there are lots of charlatans out there, so you really need to be led to the right kind of omega-3s. And I just want to end this with another brief story. This to illustrate the importance of omega-3 fatty acids. This kid was 18-year-old kid, was involved in and go. Google. All right. Had a kid surgeon, and came back to day. Most of us don't offer 20 grams of omega-3 a day. And anyway, after all that, the man came back to life, and after that, he had 2 more kids. So, which means it wasn't just his brain that recovered. Okay, all right. So she did that, and for her kids, now that's a kid pulling, is lifting in. But there are 4. You got to. Each of these areas have specific needs. The brain has a specific nutrition, and so does. Understand how needs in the breakout, and you face the handicaps of disease. They may lengthen their lives, and so thank you very much.
But then if you say that the average recommendation as it concerns the grams per day is 3 to 6, and the dude you showed us was on 20, is it safe to ask what the average should be for a child on the spectrum? Question.
And some kids, if you 3 grams a day, I said most people have to find percent of the omega they're meant direction.
On some education, really know said some of the things
because I think that's a very good question. Mr. Darren Daniels.
Well, in the effort to be repetitive, I'm going to address that actually in the next session. So if you stick around for that, I think you'll get what you're looking for.
Thank you for this morning. I hope everyone and one today, and lots of short break. Which sort of body on a roll basis. So please just do. Now, the two important things to make time free, so people please all is also registration for being and we would also have Dr. Ajibade come up again. So it's going to be two speakers at that session. He's going to come up again and talk about an intelligent step-by-step approach to optimizing your child's healing. And in the other hall, which is the Ajip hall, we would have Daniels, managing director in the. So he was the one to the question. So from 1 o'clock, we to growth of all and to belong. We're going to have a tea break. 1 o'clock, we're can refer.
Wouldn't you rather?
To the world, never we can come along the and just both to agree. I believe that I can be forever. Yes, I believe best. My in your good ride. There's a sky. There's a head or would you rather trust me? There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Whatever. It's never great. Just a setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about your best in whatever I do. Guaranteed to take the lead. One of the best in whatever I do. Guaranteed, yes indeed. Two of the best in whatever I do. Would you take my hand and let me lead? Would you rather trust me? Trust me. Trust
teach with us.
I love you, whether it's wild for all I can guess and got there's the
Trust Bank. Wouldn't you rather bank with us?
The air and free. Just for me, I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? Believe that I got as whether it's necessary. Everything is
this room, okay, be in adjunctive abilities for great in this room take in autism follow this room Susan Ryan, that's for in this Gordon trial training strong for school and community your need in speech content. Right, okay.
Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my head down and be me. Just a smile for a start, and it only takes a spark to begin a fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about everything to make your dream come true. Everything is you. I believe that I can be all of the best in whatever I do. Guaranteed to take the lead. All of the best in whatever I do. Guaranteed, yes indeed. All of the best in whatever I do. Won't you take my hand and let me lead? Would you rather trust me? There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best in whatever I do. Guaranteed to take the lead. One of the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. Would you take my hand and let me lead? Would you rather trust me? The silver ever died. Ooh, but ever died. The silver ever died. Would I lay my hand and let me lead? Would I take my hand and let me be? Would I just trust me? Would you take my hand and let me lead? Would you rather trust me? Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile. So just set your mind at ease. We care about the things you care about, and we can make it happen for you. We aim to please, to reach the guarantees, trust that we'll be waiting for you. Welcome to the future. Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my head down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about everything to make your dream come true. Everything is you. I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed. Only the best in whatever I do. Won't you take my hand and let me lead? Would you rather trust me? There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best in whatever I do. Guaranteed to take the lead. One of the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. Wouldn't take my hand and let me lead. Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. We care about the things you care about, and we can make it happen for you. We aim to please, to reach the guarantees, trust that we'll be waiting for you. Welcome to the future. Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my head down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be all of the best in whatever I do. Guaranteed to take the lead. All of the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do.
Good afternoon, ladies and gentlemen. I hope we're all able to manage to just grab something to eat. And we're kicking off now into the breakout sessions. Just a reminder that in this hall, which is the Shell Hall, the presentations that we would have between 1 o'clock and 2 o'clock, Growth of Autism, Special Programs in Nigeria, Best Practices by Mrs. Dr. Akonde, and An Intelligent Step-by-Step Approach to Optimizing Your Child's Healing by Dr. Dayo Ajibade. That presentation, those two presentations will take place 1 to 2 in this hall, which is the Shell Hall. For Assistive Technology and Accessibility Solutions by Darren Daniels, that will take place at the Ajib Hall. Ajib Hall is where we had the registration early this morning. So Ajib Hall for the second session, 1 to 2, and we'll start off in the next 2 minutes. Thank you.
Yeah, sure.
There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best things, whatever I do. Guaranteed to take the lead. One of the best things, whatever I do. Guaranteed, yes indeed, to be the best thing, whatever I do. Wouldn't take my hand and let me lead. Would you rather trust me?
Okay, now I'd like to call up Mrs. Dr. Akonde, the proprietress, Patrick Speech and Learning Center, to talk to us about the growth of autism, special programs in Nigeria, best practices.
Thank you. Good afternoon, everyone. My name is Dotsun Akonde. I am a... He lost... After he had up in a particular, he will draw certain things. He would withdraw when we had visitors. We would just find out that he had withdrawn into his room. He didn't want to be around anyone else. It was a journey, but the journey today is why I'm standing. When he was 6 years old, we decided, along with, eventually, the story is very long, I won't bore you with it, because I'm sharing this slot with my brother, Dr. Ajibade. And the story is very long. Heard me talk. How many people have heard me talk? Let me start with that. So, quite a number of people. Where that came from. It's still a challenge. Because if you still tell him to narrate stories, he will have challenges narrating the story in a summary. He would still take it on like a story. And the reason why comprehension would also affect his learning is because he would need to read questions, exam questions, and be able to answer them appropriately. So we are still working on that. Social skills is much, much better. He's connecting with his friends. He's very we said I told my husband, let him go to community college. I'm okay with that. My husband said, no, let him go to university. But before he goes to university, let him take a gap year. And we can teach him all the skills, because we had to teach him banking, we wanted to teach him driving, we wanted to teach him everything, we wanted to introduce him to the world. He eventually skills. Said, okay, let's introduce him to A-levels. So we told him, do A-levels, do your physics, maths, chemistry, choose those 3 subjects. And to our utter shock, when the result came out the A-levels result is not out yet, but when the school's result came out, he won the best student in academics. Not is different. Like I want to correct today, because I know many people love to hear. There are many that do not have that much successful in one of my very best. I want him he will use it when you corner him, when you put him into a corner. When he walks into the center, I will just stand in front of him and I will be nodding myself and doing like this. What should come next? I won't say anything. I will just be doing like this. And then he will eventually say, please, can you get out of my face? Let me just say good morning to you. So he will say good morning, and then I smile and shake his hand, because I want to hear your voice. I want to hear it. It means a lot to me, not because he's going to be, not because is the tool that is needed in this reward, because there are so many ways of communicating without using words. I mean, there are many times we are quarreling with our husband and we know how we pass. So I'll go to my short testimony. And there are so many children that have passed through us at Patrick's doing regular. Have gone on to some of them have gone on. We have asked the older adults that have gone on to come back and help us work with our children at the center. That is how Patrick's has evolved, and that is the growth that we've been able to achieve in the field of autism. And with the help of Gtbank, we've been able to have the expertise right on this front row, teaching us every step of the way. There are times that I send messages to Dr. Sutton about what I'm seeing and to help me back and get on the way forward. This is the beginning. That is myself, my husband. That is our director. The director of Patrick's is also a director in GTB, and that's Mrs. Odedino. That was the first day, the opening of the center, 2006. 10. Making so much progress, and I said to myself, there must be other families out there going through what I'm going through. Let me just open up some. Put our hands into anything. It must be very big, and then they supported the opening of the center. Fantastic work. What is autism? How can I take one or two? I don't want anybody from Patrick this question. Can you please, somebody just tell me what autism is? What you think autism is? I don't want you. No. Can I? Even with, can you say
mental disorder that affect the social behavioral pattern of the individual affected and the intellectual
You see, anytime I hear it on NTA when they go, or any of the networks when they go out asking what autism is, I just sit down in my sitting room and I laugh. So many people have different versions of what autism is. There are 3 things you need to know. Child skills, and communication skills of individuals. I mean that they are can be like this, but she's not able to talk to you one-on-one. Her name is Ross Blackburn. She said sometimes when information is being passed to her, when somebody talks to her, it takes her 3 days, sometimes 5 days, to be able to process that into action. That is why sometimes we see our children incessantly for no reason. It could be that an information that has been passed to them has just finalized its process, and then they start to laugh. Huge from this, and that can be used as a benchmark. An example of that is the ABA, Applied Behavioral Analysis. It's been used as a benchmark. If anybody walks into Patrick's today, they say, do you use ABA? I say no. I use parts of ABA. I don't use the full ABA. The reason being that quite a number of times, some of our children don't work well with the technique ABA. Most about between 7, my oldest staff is 9 years old, then the one after is 7 years old. So you see, we've worked that in the, been able to train them in such a way that they are able to imbibe some of these practices in them. They did not come to me knowing what autism is. The psychologist in my office did not come to me knowing what autism is. We had to teach it. So we can say in the Nigeria of today, it is still a new discovery. We are still in it. We are not experts in it yet. We are on the road to being experts in the field. What best means. When into your organization, you are able to give the best therapy with the tools that is needed. Some of the tools that you at Patrick's best practice, the staff. Our staff, they are all trained. Every year we bring together a team of specialists to come and train us at Patrick's. I don't take people that have worked before. The reason being that people that have been introduced into the school system are not able to easily adapt to the techniques of working with children with autism. People that have been in classroom settings, sitting on a chair and teaching a child, will not be able to go down to do floor tests with my children. And I of that is available worldwide. We get people from Canada. Last year we had Heather Mackenzie from Canada come to teach us speech and language therapy. We've had a behavior analyst coming from Canada as well. We've had sensory integration Egypt, just from communication with what is going on around the world. And we have the first meeting. That's how, when you come into Patrick's, we have the first meeting. First meeting, decide hearing test, child sees that the child will need to come, then the monitoring evaluation. That is part of our best practices. We do it every time, sometimes within ourselves. We call somebody that is working in the field of OT and sensory integration to come and teach us what he's learning. And our best teachers are the children and the adults. If you observe the children or the adults and you think you can put through the skill, you are going to wait the child and you treated. First meeting, like I said, first meeting. And we go through the birth history. We take a logarithm of everything that they've been through. When did he walk? When did he talk? And then we decide the next step. That is our assessment team. That is when the child is being assessed. After we have decided the child, to get to this stage, the child must have done a hearing test. The child must have a diagnosis of autism. If the child doesn't have a diagnosis of autism and the parents cannot afford to get a diagnosis, we will work with what the challenges we are seeing. So for instance, the child is not talking. We will take that as one of the challenges. The child is not attending. We take that as one of the challenges. The child cannot initiate conversation. The child cannot diagnose it. And we go through the assessment. Again, we sit down, have recommendation can be that it means that the child doesn't need to come to Patrick's, go to regular school. He can see us after school, 1 hour after school. It can be that the child needs to come to us fully. Depending on what we find, we discuss with the parents and we draw up a plan. This is like one of the plans that, an idea of what our plans look like. The child would, the child from there down. Then comes the curriculum goals. What do we need to achieve? The child has to be able to, sit attentively by the end of the term, by so and in the afternoon, make up of that child and use that to develop IEP. Selections of intervention. We can use various intervention. We borrow from ABA, we borrow from TEACH, we borrow from speech and language therapy. We use different tools and then we merge it together and create our own unique curriculum. We do have a unique curriculum. We look at the classroom accommodations. Will the child be able to learn with things on the wall? Will the child be able to learn in an open chair? Do we have to put a corner chair in place to try to get the child to attend to the skill, to be able to sit for of time? We look at that. We look at the teaching we need. Do we need to use pencil grippers? Do we need lined papers? We look at all the teaching aids that we need. Then we take that data. We take a data, implementation of behavior. We will those things that we take into our documentation, and then we get a feedback from the home also. Every day, there's what we call the communication book. We send it to the house. When the child is coming in the morning, child has to come with it. That helps us to understand what went on last night, since we are not a boarding facility. Did the child sleep? Was he able to, did he eat this morning? Do we introduce him to activity? Take that as that is what we are maintaining up till today. And that is the beauty of Patrick's. We don't lump them up in a classroom and teach them. We bring them out one after the other. We have the communication, which is speech. We have a very good speech team that has been put together. Recently, one of our consultants the students that went into speech and language therapy came back with her degree, and she's helping us refine very and communication. Skills is also very big in Patrick's. We must get music every blessed day, because music is talking. Must get the talent in December. Take what the children have been learning since January. We put it into a production and we show parents. So you can imagine simple steps to do this. Some of the children cannot move. They don't know movement. They don't understand sound and movement. And that really helps develop the brain. So we are very, very big with music. Another thing we do is we get the old or the children. You know what that's evidence. I remember when one of our adults, we decided to do that, and he said to me, Mrs. Akon, it's my ID card. Wow. They carried themselves in a different manner. They were able to, feel more confident, feel useful than being looked down upon, than being talked as. They felt they were in charge, and that was a beautiful one at that we were able to, recognize at the center. That really changed my focus also with the adults living with autism. We also have the self-regulation. That means the ability of the child to be able to control himself in certain situations. That's why when you go to church and the music is so loud, the child with autism begins to jump, cannot tolerate it. We have to self-regulate it. What I tell parents is that you try, most of our children don't care about the noise. They care about and men. So we need to kind of withdraw them at that praise and music. I'll tell you, there are my son, when he comes back from school, he has this habit where he must put on his music and pace. That is his own form of self-regulation. After going through all that, trying to be who is not really is, but conforming with the society in the school environment, comporting himself, listening to the teachers, saying he becomes, and we need on without start balling and get them to they tune out of you just attending you will we need it as well. We are big in academics. Typically what happens is in the very young group class we have between the ages of 2 to 6. In the other classroom we have between the ages of 4 to 9 and sometimes 10. When the child gains speech, when the child is able to attend in the classroom, when the child has now graduated from that classroom, we transfer the child to the next class. And that next class, typically what happens in the school system, classroom setting school. So we are in the regular school. We now begin to introduce times a week into this school, depending on how well adapt in that classroom. As you can see, we have these are our young adults. This classroom is also, we also have it set up like this for our very young ones. So they can take whatever you are teaching that day, do their work, put it back into the finish box, and then you pick it up, and then if there's at any point in time the child needs help, able to indicate me. Set up like 3 line of box. The classroom was family. At 12, when they say, oh yeah, we can't take, come at. Some parents are so, they are in denial to that extent. And it saddens my heart when I see them at that age. It doesn't mean that all hope is lost. It just means that it takes a longer time to get through to them than when they were much younger. So please, parents, don't say my child must go to regular school. Yes, we are very much inclusive education. A while, and there are people that are 4 years. And also it depends on the kind of therapy that the child received when he or she was growing up. Very, very, if you see our children in the labels of wear socks, some don't would like to wear clothes, some need a lot, some hold hands to their ears to cover their ears from loudness, some shut their eyes, some look at the lights, some look for the corner of their eyes. Those are some of the sensory difficulties they are facing. And we have a very strong sensory room. This is our sensory room with our occupational therapist. That working with children in the I must say I have the most dedicated staff in the whole of the world. They have their challenges, yes, but they are the best in the whole of the world. I drive them, and I drive them. Behavior, like I said, that is a major part of the plan for the child. If the child's behavior is not settled, there is no way you can teach anything to that child. I will give you an example. We had a young lady that was our first adult at the center. She came to us at, I think it was 15 or 16. And she will come in the morning. When she wants to communicate, she would only communicate with behavior. She would throw herself in the air and, hit the ground. And we were so shocked. We didn't even know what to do. We were just staring at her for a long time. Then we said, but she had this precursor behavior that she would exhibit. She had a sound that she would make that you would know that the behavior is coming. So when that sounds would start, we'll clear the classroom and we'll leave her. And myself and the current head of school, we stand in. And what we did was that we would watch her. She wasn't harmful to others. She was only harmful to herself. We would watch her communicate with the behavior. And at the end of it, any slight opportunity she creates for us to use our voice to talk to her, we will go in immediately and say, Amaka, that behavior is not a nice behavior. You need to let us know what you want by using your words. She had words, but she wasn't using it. Please use your words. And then we will quickly reinforce the fact that she wasn't exhibiting that behavior at that time. And to our utter surprise, in 6 months, she lost that behavior completely. To the point that I met the father at the DSTV office, and he said to his friend, come and meet the miracle worker. We didn't do any miracle. We only put strategies in place. A lot of children are exhibiting certain behaviors, and the parents are saying, stop it, don't do that. You are feeding that behavior. Let the child have the behavior. At the time the child is quiet, tell the child that you don't use this as a means of communication. Let me know your needs. Even if the child doesn't have words, let him use gestures. Like the beautiful guy that was being taught sex education and pointed to the picture and pointed to himself. That is communication. Trust me. And so you see them feeding that behavior, and they say, my child is not attending. It's because you are feeding it. You need to teach the child the strategies to be, and then build a protocol. You don't need to go and read up on it on the internet. Just try a few things. Okay, if he does this, this is what I'm going to do. Try it. If he does this, this is what I'm going to do. Try it. If it doesn't work, I went to my friend's house and she said, Mrs. Akoni, this boy is always sitting on this settee. I'm always telling him, he will just come and lie down on the settee. I said to her, turn the settee upside down. If the settee is turned upside down, for crying out loud. And the boy went there, looked at it, and went away. And all the mother said was, the reason why I turned it upside down is because I don't want you to sit on it. So you will keep turning it upside down and turning it back up. After a while, he will understand that truly you don't want him to sit on that chair. Sometimes it's not as easy as I've said it. It takes time, it takes love, it takes patience, it takes the grace of God. But please try it. There is beauty in the belly of each and every one of these children. That beauty will only come out if you are opening yourself up to that child. If you have decided to accept that child, and they will know. They know when you are endeared towards them, and they know when there's disdain. Even if you don't say it with your words, they read it in your body language. So please, let us try and not use behavior as a means of communication. We have independence and life skills for our adults. We have, like we said here today, many of them will grow up from children with autism to adults with autism. Are we creating employment opportunities for them? This is why we do that at Patrick's. So that one day, we are blessed that Murtala Mohammed Foundation has said to us, we will support your employment program if they can do admin work. We take them through photocopying, filing. We teach them how to arrange things in order. We teach them how to laminate. We teach them how to pick up the phone, use the mobile phone. We teach them banking. We take them out once a week with the ATM card. We show them how it goes into the machine, what to press, and how to come out. They don't need to be able to talk to be able to know those skills. Those are life skills that you can teach the adults. Many parents come to us with their adult children and say, there was a parent that walked up to me and said, Mrs. Akonde, I'm not getting value for money. I told her to go and collect her money back. I told the secretary to pay her back. I said, because your boy is 18 years old, madam. You've been with us for just 1 month. There is no miracle, as much as I love your son, that we can do at Patrick's, that you will be getting that. And then the fact that you are even putting value on top of my son. That's what I told her. That means that you are not even interested in, you are just thinking about the money you are paying. And if that is the case, you keep paying, and then what happens if you don't have to pay anymore? There are times at Patrick's when families have been paying. They didn't ever say that the child will be with us for 4 years. They've been paying in the past, they are paying, very well, and then in the middle of the program, they say, Mrs. Akonde, please, I cannot afford the services fees anymore. I have to take my child out. We've been able to re-support those families. At Patrick's, currently, we have about 42 families, children and adults with us. We have 13 of them paying full fees. We have 13 not paying at all, indigent families. We have those in between. Pay some today, pay some tomorrow. It's because we decided on our own to be able to give that back to our community. I am not really saying this so that you will applaud me. I am saying this to tell you that it is possible to support families. We have never borrowed in the 9 years. Thank God that GTB was able to support us at the beginning. We have used the resources that we have. We do training, we do programs for families, we make some companies pay for those services. And we are able to roll over. The only one thing that is constant is we are able to pay salary. My staff is here. There has never been a day, a month, that they have gone without their salaries being paid. And that is the beauty of being able to extend the community. Many families, there are times when some of the families will tell me, I can only give you toilet roll this month, and then we'll take it. And we know that there are some families that are so rich but do not want to, kind of support their children in Nigeria. They take them abroad. And I tell you, the services we provide in Nigeria is nothing compared to the world. Do you well, sister trains my son. My grandma trains my that's skills get better. Community is actually clap for yourselves. Parents' involvement, key. For parents that cannot afford services, go for training and do the work yourself. Put strategies in place yourself. Nobody can help you if you don't help your child. When my son started therapy, we did not have money to send him abroad, but I had money to be able to do some teaching to say, you are not going to wear that trouser the other way around. He will wear this trouser back to front, t-shirt back to front. I was able to teach him those skills. I said to him, if you will not go to school, you will play for the church. You will play piano for the church. So go learn music. We need to be assertive for our children. The Patrick Speech and Language Center is not a dumping ground. The staff, if the staff comes in the morning and the staff has had a horrible day in the home, maybe the husband has annoyed her or the wife, there is no amount of words you can put into that staff's brain that she will be able to work with that child. They are human beings just like you and I. They are dedicated, yes. They have love, yes. But sometimes it just doesn't work together. And we must appreciate that. They are also human beings. Your money cannot buy whatever. If that staff is down, your money can buy it. I tell my staff, if you are in that kind of situation, take a walk. They never do. But I always encourage them to take a walk because they also need to self-regulate. So parents' involvement is important. What we do at Patrick's, we come in. You can come in at any time. Say, today I want to observe. We put you in a classroom, you observe our sessions, and then you take that back into your home and use it. You are free to ask questions. You are free to contribute. You are free to say, no, this is not working for me. We will address it if it's something that we agree with. So parents' involvement is key. Without them, we will not be able to have Patrick Speech and Languages Center because it's their children that we are taking care of. The outcome and the review. is very important. We set goals and then we look at it. Have we achieved the goals we set? Do we need to change some of our strategies? Do we need a behavior protocol in place? Do we have to train? Do we as staff need more training in a particular field? For instance, we see we are lacking in social sensory integration. We look for somebody that is very good anywhere in the world. This person comes, tells us what we contact the person once or twice or as needed, as on a need by need basis, and then we put does it take some of the skills home? Do they see what we are doing? We are to go with that vocational training. Mike. Dr. I think sorry, doctor, can you wait a minute?
First, thank you for that wonderful program. As you know, I've seen many programs in the United States, both working in them and inspecting them. You've got all the elements of the best of programs that are.
And answers after. Doctor, thank you. Let me give you the listening. Patience.
Thank you. Okay, please let's give Mrs. Akonde another round of applause, please. Great job. Great job. Okay. Excuse me just a minute. Let me see. Just a minute.
Life, just come take a dive with me. We can change the world with a smile, so just set your mind at ease.
Sorry about that. Please, let's give her another round of applause. Good job. Really good job. Thank you. I just want to echo what Dr. Sutton said. This is fantastic. It covers practically everything. Do you have any centers in Abuja by any chance? Are you planning on it? Why not? Okay, we need to talk about it. But I think everybody needs to collaborate. I know the OLG is doing a fantastic job in Abuja as well. I think she's here too. Dr. Doris, are you here? All right, Dr. Doris doing a fantastic job. But I think there is such a big field that we need as many players as possible involved in this. I mean, awareness is one thing. I mean, even if it's just for awareness sake, letting people know about this, about the condition and how to help their children, I think it's very important. But also for therapy and helping the kids. Just before I quickly get into my presentation, just a couple of things that came out. I just want to emphasize time. time is so important. It takes time for these kids, whatever therapy you're giving them. Don't be too anxious, don't rush it. Time is very important. All right, let's talk about this. Obviously, this is just going to be an outline. We just felt we should just give an overview on nutraceuticals and how to use them in a step-by-step fashion when it comes to helping your kid. Obviously, many of you are already on treatment. Many of your kids are already on treatment, and so if you are to add something to their regimen, obviously it would be advisable that you get some kind of direction. There are people who know about nutraceuticals or biomedicals. Diet, let's really talk about that and get it out of the way. Many of your kids obviously are very allergic or hypersensitive to certain foods, yes? Some of you have very restrictive diets. I know some kid who the only thing he could eat was rice. Couldn't have anything else. Somebody else was just okra and amala. So we have some very restrictive diets which compounds the problem, obviously. Because if you're only having something starchy, then that kid isn't getting vitamins and minerals, he's not getting the right proteins, he's not getting the right fatty acids, and we talked about that. And so these are all compounding the problem and making things worse for his or her brain. So you've really got to take it seriously. Think about that. When it comes to nutraceuticals, the key thing is the immune system. Everybody, let's say that together. Say that with me. The immune system. Again. Good. The immune system, which basically go wrong, and also by the immune system. So, I'm so the diet. Just going to do a quick overview of autism already, but let's look at some of the main things. I think I'll get to that later on. The key thing behind autism, what people are proposing is that there are two elements to come together. There are the genetic elements, and then there are there's a toxin or a stressor. Everybody say stressor. Stressor. So a stress that is placed on a child at a critical period in his or her life that affects the immune system primarily. It affects other systems as well, but affects the immune system. And since the immune system is your defender, it turns a lot of things off. So therefore, you find in some kids, there's a multiplication of viruses. In some kids, there's a superabundance of fungus for plural. In some other kids, there's have an overgrowth of candida, some other kids, bacteria. In some kids, altogether, it's about worms. Okay, there's a kid running up and down here. This is not part of the show, by the way. Okay, any chance, because they're following him with their eyes. Okay, so the toxin tends to knock out the immune system. It also tends to knock out the brain, certain aspects of brain, aspects of the immune system, certain aspects, and the full symptom. House girl came to the house, and because they were not used to that house girl, it was a stress on her system. It was a stress on the child's system, and so it didn't do well. So the bottom line is that the immune system has been knocked off or knocked out to some degree. It's not working like it should. It's attacking things it shouldn't be attacking, and then it's not working where it should be working. Many kids tend of or incidents hearing than normal kids do. 10 times. It means that there's something apparently wrong with the immune system. So what we try to do when we start and work on these kids is that obviously they've tested elsewhere, so they've come to what we try to virus nation try there. Some of you know who this lady is, but I just wanted to have a picture of her because she is a mother with autism too. And I think she's done a really good job of listing all the different things, the toxins that are affecting a child. Of course, it differs for the children, but many children have one or more of each of these things. Food allergies also produces it produces a kind of toxin in the system as well. So our key do I have to read the cause and the effect? It's not coming up. Oh dear. All right. The 80% of the immune system, 80%, everybody say 80%. Some people say 70%, but about 70 to 80% is resident in the digestive system. So if you're going to aid the immune system, must be, again, we use nutraceuticals. Make the immune system work and to mitigate and reduce its overactivity, because again the immune system is very, very hyperactive in many cases. And these things that we're talking about here, folks, these are not just, we're not just dreaming of these things. There are researchers in different fields, whether in gastroenterology, which is the study of the guts, or in the brain, or neurology. They are looking into what exactly is happening in the brains and bodies of these children with autism. Actually, tissue in these aspects. And this is something that's disease affect parts of the body. If you understand what's going on, and you can use safe methods to reduce or to help the body heal in those areas. And that's where people like me come in, because we now look at, okay, what does the brain need? What are the building blocks? What does the brain need to function? And we supply that. What does the gut, what does the digestive system need to function? And we supply that. And so I thought a profound and on the gut lining. I wish I had a picture. Many times because of allergies, because of toxins, that gut lining is damaged. And so there's a lot of inflammation, and so the right nutrients can't get through the gut wall into the bloodstream, and therefore can't get to the brain. Sometimes the wrong things that get it past the gut wall into the bloodstream and affecting the brain, causing all kinds of other issues as well. So one of the key times and then 10 times than your cells. Bacteria exert a tremendous effect on the functioning of your brain and body. And so if you can strengthen the good bacteria, the healthy bacteria, and destroy or eliminate the bad bacteria, you go a long way. I have this many. Yes, I'm sure. Actually, research, a lot of research research going on to show this connection. Stand for gluten-free, soy-free. Some of your kids, you may not know it, but soy can actually act as an allergen to your body and cause toxins, inflammation in the gut, and then casein-free, which is found in milk. You want to watch out for these three things. If you can reduce those, some kids tend to get better. Now, I understand the it can be very, very difficult. And you have to eliminate. But those who have been able to do that, it seems it has helped a lot. Okay, so you need to see come in, nutraceutical, the right probiotics, anti-inflammatory, we talk about zeolites. How many people have heard about zeolites before? Zeolites, that's the fourth one from above. Wow. These are, Google it. These are, they are made from volcanic ash. Scientists are now using it to clean up the body in human beings, but also in nuclear waste. They're using it to cleanse the environment. Extremely safe for that purpose. Toxins and heavy metal. We nanosilver because again this has been very safe, proven to be very safe, and we also advise that people use anti-helminthics, which are worm expellers. I mentioned in the last talk that many times, I have to say this, I mean, if we're going to wait for these things to get into the standard approved medical books, you may wait a long time. We're just giving you pointers. One can be for even the doctor asks can be is with these kids. All right. I hope to improve this. I can keep going, right? Okay. Okay. I mentioned this quote last time. I have come to the realization that most autism spectrum children, that for most seen more of pathology. I have with like talking about. It's amazed that in different ways and place. All right. And just in the running out in them, two main regions of the brain, and this is coming out of Harvard University in Boston. Two main problems. I think okay, it's probably another presentation. Two main regions. The part that controls emotions and moods is overdeveloped, or in some cases dysfunctional, and also the control how this is not before. You need to be related. I'm not just Omega-3s, you can't just go and buy cod liver oil and think that you are giving your child omega-3s. You got to have the right kind of omega-3s. All right. Some people promote stem cell treatment. In other parts of the world, we deal with nutraceuticals that have been scientifically proven to stimulate stem cell formation. Stem cells are basically new cells in your body that can help to replace damaged cells. As children, you have more stem cells. As adults, you have fewer. So we use things that can help to accelerate that. Are we done? Okay, let me just finish up with here. Okay, and I think we've covered the brain. We've covered. Okay, I'm just going to mention a few things here, and that's too much. There's a few testimonials from people who use the right kind of nutraceuticals. We see some improvements in speech. We see some improvements in behavior. We see some improvements in speech, in sleeping. And I just want to say this, that in most parts of Nigeria, they just don't have access to these therapies. They just don't have access to them. So it's very important that if you know of people, they can start somewhere. You don't just give up. There are always solutions. There are always things that can be done somewhere, somehow, for your kids with autism and on the spectrum. Again, I want to thank you for listening. That concludes my part of the speech.
Sorry. Okay, I wanted to show you this. I'll show you this one. Okay, thank you. And we would have very quickly, so that we don't, because we're already 1 hour behind time today, and would trust to just ensure that we stick time. Audiology Innovations by Miss Susan Wright, who's an audiologist at the University of North Texas. She will be speaking with Miss Aliyah Gordon on discrete trial training in this hall, Shell Hall. In Ajipol, we would have school and community helping individuals with special needs participate in the political process, a process kit for citizenship and voting by Dr. Yinka Akindayomi, who is the Service Director of Children's Development Center in Nigeria. So please feel free to join either of the two classes, two sessions going on, and that will take place between 2 o'clock to 3 o'clock. And right after that, we would have the lunch break. So just let's know so that we can just settle down for, then we'd have Miss Susan Wright. I think you'll be coming up first. Okay. Okay, oh, you're coming up first. Okay, so I would have Aliyah Gordon come up first to talk to us about discrete trial training. Thank you.
Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. Welcome to the future.
The clicker. Where's the clicker? I think we take it with him. I think he took it. Maybe he took it.
Iris for 25. Hi, everybody. Hi. Do you want to get up and stretch a little bit? I think that would be a great thing. So let's get up. We'll stretch all the way up. Oh, that feels nice, huh? That's good. Good. How we stretch all the way down. Turn around. All right. Does everybody feel a little bit better? I feel a little bit better. So hi, my name is Aaliyah Redwine, and I'm going to be talking to you guys today about discrete trial training, which is a fun and exciting teaching methodology. And I'm really excited to speak with you guys here today. So a little bit about me. There's my husband and my dogs. Yay. I have a bachelor's degree in psychology. I'm a board-certified assistant behavior analyst. I've been in the field of autism and developmental disabilities for a bit over 5 years. I did my BCABA coursework at Florida Institute of Technology, and I'm matriculating August 31st to the University of Pittsburgh for a degree in early intervention, a master's in education early intervention with a focus in autism. So I'm pretty into the field. All right. If you have questions during my presentation, if they're short, raise your hand. If they're long questions, we can address them after, or you can come talk to me individually. So my presentation time got cut down, so I was going to go through the Diagnostic and Statistical Manual, the diagnostic criteria of autism, so we all have the same reference point, but I'm actually going to have to skip through this stuff so we can get to discrete trial training. So here we go, we're skipping. All right, so discrete trial training, there. Discrete trial training is a model of instruction that emphasizes a highly structured approach to teaching in which the child and therapist sit at the table. Various skills are taught during discrete learning trials. Skills are broken down into smaller units of behavior and taught to mastery. Mastery means that they can reproduce it regularly and without any issue. And a brief inter-trial interval is programmed between trials. So this is really important. Highly preferred items and praise are delivered following every single correct response. This is a big, big deal. And sessions generally consist of a specific number of trials that may involve presenting the same discriminative stimulus. So discrete trial training was developed in the 1970s. Early studies showed that young children with ASD who are treated on the discrete trial training model increased IQ scores, decreased inappropriate behavior, increased spontaneous social interaction, rapidly acquired skills, which is a huge deal with our population. We want to teach them as much as possible, as quickly as possible, and increase the ease of data collection. Now I'm just realizing I'm talking very quickly, so I'm going to slow down. All right. I have a video here that I'd like to play. Is there a way for me to play this, guys? I just want to give you guys a visual example of what I'm talking about during discrete trial training. I always find that incredibly helpful while I'm watching presentations. It's a video. This, yeah, if you click on it, it should be embedded. See? Yeah, I think so. It was in the file. Yeah. Oh no.
All your video elements must need to be on this computer, and then.
Oh no. I mean, I have it on my computer, but if we can't watch it, I mean, I can bring my computer up.
Bring your computer.
Can you bring me my bag? Sorry about this technical difficulty.
You care about, and we can make it happen for you. We aim to please this with guarantees. Trust that we'll be waiting for you. Welcome to the future. Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
There's a place I long to be.
So I'm going to talk around this a little bit while we figure it out, if that's all right with everybody. So what this video shows, you can see me and my student, and watching the video, you wouldn't think that, you would think that she was completely neurotypical, that she wasn't on the spectrum, because the way that she responds is very regular, it's very understandable, but she is a high-function Asperger's syndrome. She reads, she writes, she can ride a bike, but she also has incredibly difficult behavioral outbursts. So this is a way where I can maintain instructional control and where she's engaged because it's rapid fire. So we try and have between each trial, we try to have less than 5 seconds of time. So I would ask her, what sound does a cow make, right? She says moo right away, and I count in my head 1, 2, 3, 4, 5, and I'm gonna give her a reinforcer, praise, an edible, something along those lines within those 5 seconds, and then I need to ask my next question. So apparently we're not gonna get the video, I'm sorry. So that's pretty much what it makes. I'm gonna break it down. So here's a quick brief word about preference assessments. I put some things up there that are reinforcers for me. So before beginning any sort of therapy, you need to know what your client will work for, what motivates them. This is incredibly important because if the child or the client is not interested in what you have, they're not going to work for you. It's just not going to happen. They have other things that engage them. It might be self-stim, you know, we have flappers and light lookers. It might be daydreaming. It really depends child to child. So you need to have something that they really want, okay? So between each discrete trial, you need to use verbal praise and small edible reinforcers so that you have a very short inter-trial interval, that space between the end of one question and the beginning of the next question. And also, giving your client a choice of reinforcers, not just having the same things available all the time, is really important because satiation is a huge issue with what we do. If your kid really likes to play board games and you only have Chutes and Ladders or Candyland, your kid is not going to want to play Candyland after 6 sessions. They're going to be completely bored of it, right? So you need to have something different for them to choose from. Running around outside, playing a different game, playing with cars, whatever that specific child finds reinforcing. And it might even just be like, I had a kid who played maps on Google Maps. He would just like click all over places and he would change the view. And he loved to do it 10 minutes at a time and he was in really great shape. So it's a big deal that if it's not a reinforcer unless subsequent behavior increases in response to that thing. So for me, as you can see, I like shopping. I like my computer. If that reward is given, the behavior that preceded it for me is going to increase. So let's see, I clean my house and my husband was like, here's $100, go have some fun. In the future, I'm going to clean my house more often because I got that reinforcer, right? Right? Or I had a terrible day at work. I worked really hard, and I get home, and there's a bottle of wine, and dinner is cooked. In the future, I know that there's a reinforcer coming after a really difficult day, and so I'm more likely to push through instead of giving up. And that's a big, big deal that our kids need to know, that there's something coming that's positive. They need to know that it's not, you know, like it's not all bad. They don't always have to work. Because these kids are challenged, really challenged, and it's our job to help them function in this non-neurotypical world. All right, so one of the teaching methodologies, part of discrete trial training is called errorless learning. So errorless learning was introduced by B.F. Skinner, who's the father of applied behavior analysis, who I personally love. I think he's the coolest. In the 1930s, as part of his study on what would make the most effective learning environment, Skinner says errors are not necessary for learning to occur. And errorless learning guarantees no mistakes. Hey, Yinka, can I borrow you? All right, so I'm gonna put you through an errorless learning exercise, right? Okay, so let's say that Yinka is completely nonverbal. He's not a kid who speaks. But I want him to start to sign, which is something that I work with a lot of kids doing. So let's say that Yinka finds my phone very reinforcing. He wants to play a game on it, right? So this is the sign for phone, right? So the first thing I'm gonna do to guarantee that he does this correctly, I'm gonna make his hand shape into the Y, and I'm gonna put it to his ear. Phone, great job, I'm gonna give him this. He gets it because he signed it. Now that's errorless. There was no way for him to make a mistake. Now, after I've been able to do this 3 times, phone, perfect, here you go. All right, phone, awesome. I'm gonna move my hand down and see if he'll make the hand shape himself. And if he doesn't, ooh, I like how you made the hand shape yourself. And if he doesn't make that hand shape himself, I'm gonna put his hand in the correct position, right? Now I'm gonna move further and further up his arm and further away from him. Now he can independently, hey Yinka, what do you want? Perfect, errorless learning, right? It seems logical and it seems very basic, but it's a huge, huge way for our kids to learn. They need to know that you have the answer so they can get the answer also. This is a big deal. Thanks, man. Have a seat. Can we hear it for him? Yay, Yinka! All right. In my video, you would have seen something called a token board, which is a form of token economy. Token economy is a system of behavioral modifications based on the systematic reinforcement of target behaviors. These are behaviors we want to increase, not decrease. The reinforcers are symbols or tokens that can be exchanged for other reinforcers. I tend to use pictures and something that the child is specifically interested in. Let's say Spider-Man. This kid loves Spider-Man. So I'm gonna have a board that has a picture of Spider-Man, and I'm gonna have 4 or 5 tokens, and once that child has all the tokens filled in the board for appropriate behavior, they're gonna get something to reinforce them, which is a big deal. All right, so each token board should be specific to the learner. If your kid doesn't care about Dora the Explorer, don't make them a Dora the Explorer token board. If your kid is completely obsessed with Mario or Minecraft, that's the one you love, right? Or if your kid is totally obsessed with Minecraft, that's what that token board should be about. Watch your client, observe them. You can see what they're into and what they're not into. I once made a token board out of a fire truck. Each wheel was a different token, the ladder was a different token, and he loved it. He was obsessed. All he wanted to do was put the pieces on the token board. That's great. It's already reinforcing from the beginning, and I haven't even paired it with primary reinforcers like edibles or free time. All right, so the first thing you're gonna do is you have to pair yourself with primary reinforcers. That kid doesn't inherently like you, really. Like, that child is, at least, like, who's a therapist here or a teacher? Yeah, right? So, does that kid like you when they walk into your office? No, right? No, they know when they walk into that office, they're there to work. And that's not fun. That's not enjoyable for anyone. So the first thing you want to do is to pair yourself with primary reinforcers. Every time that child approaches you that first week or two, you want to say, oh, I love it. So you're going to say, great job. You're going to hand them something they like. You're going to play alongside them. Every time they approach or interact with you, you want to reinforce that because you want them to see you as something that provides reinforcement. This is a huge deal. You don't want to become aversive. Okay, the next step, don't be aversive. Don't tell them no right away. Don't correct their behavior too much, because you want to be something that they're excited to see. You want them to be sad to leave your clinic. You want them to be sad to leave your classroom. You want them to be excited to come back. And the other thing is, don't go too quickly. Our kids are inherently averse to people who come at them too quickly, to strangers, right? Not all of our kids really like strangers. You have to become a known factor. They need to know what you're going to do in response. All right, so the next thing is to pair the token with you and the primary reinforcer. So you're only going to do this during preferred activities. So let's say your kid loves Play-Doh. While you're playing Play-Doh and the kid is sitting with you, every time they play with Play-Doh, let's say every minute, you're going to give them a token. Oh, I love how you're playing with Play-Doh. That is a great tower. Hey, that's really awesome. And when they get all of their tokens, you can move on to another preferred activity. All right, so now you're ready to start using the token board for non-preferred activities because you've established the tokens as reinforcers. If you don't establish tokens as reinforcers, it's not going to be anything. It's just going to be another piece of paper. All right, so at first the ratio that you're giving tokens for is 1-to-1. Every correct response, you're going to give a token. Every time. Every time there's a correct response, I'm going to give you a high five. I'm going to say, hey, I love that you wrote the letter A. I'm going to say, wow, you really knew that the wheels on the bus go round and round. That's right. Okay, 1-to-3 is the ratio between new and mastered goals. How many of your kids have a repertoire of things that they know how to do? Some of them do, right? Some of them have things that they know how to do, and then there are all the new things you want to teach them. So those mastered goals are where you're going to take the basis, and then we're going to pair them 3-to-1 with those new goals. All right, 1-to-4 is the ratio between all responses and quick reinforcement. So every fourth response, that child, I'm going to give them an edible, praise. It has to be every 4, or else the reinforcement schedule isn't thick enough, and they're not going to understand that, like, this is a good thing and they're having fun. 1-to-1 is the ratio between correct responses to new goals and tokens. All right, so setting the scene. You guys saw in the picture that I was sitting one-on-one with my client, that she was not facing the door. So you need to have your materials ready. Write down your specific goals. If you don't have a specific goal, if it's just fine motor skill instead of pick up a pencil and write with it, it's too broad, and you need to narrow it down because, again, you have to know the correct response. The kids don't know. Make sure that you're the focus. You want to be animated and excited. You want that kid to want you to like what they're doing. Don't be aversive. All right, and finally, make it fun. Exciting takes up. Just get awesome. You want to give me high five. Hey, I'm counting odd numbers. 1, 3, 5, and the kid says 7. Great. I love the way you guys knew what the next odd number was. Awesome. All right, so here are some other verbal praise words. Awesome, amazing, brilliant, dynamite, fabulous, fantastic, groovy, marvelous, nice, neat, outstanding, radical, stupendous, super, swell, and wonderful. I just need to put a brief word here about specific praise. 2 minutes. You need to name the action that the child is doing correctly so that they understand. All right. Sadly, guys, my time is up, but feel free to talk to me later. I want to say thanks to Gtbank and Dr. Anna for bringing me out, and I hope everyone has a really full of learning rest of the day. Thank you.
Well done. Thank you. Thank you very much, Aliyah, for your awesome presentation. Okay, so we're going to move on to the next presentation, and we're going to have Ms. Suzanne Wright. She's an audiologist, and she's from the University of North Texas.
Okay. Good afternoon, everyone. My name is Suzanne Wright, and I'm a third-year graduate student working on my doctorates at the University of North Texas. Oops. I'm not as energetic as Miss Aliyah, but I'll try and keep you entertained during the presentation. And then my time also got cut down, so sorry if you feel like I'm rushing through, but I have so much information that I want to give to you. I just wanted to start this off by showing a picture of the lab that I'm working in at the University of North Texas. And these are the multiple studies that we're doing with children who have autism. The one that I'm going to be mainly talking about today is the third one, bolded. We're looking at behavioral and subjective benefit of remote microphone technology for kids with autism spectrum disorder. The very last one, we're also working on an app. It's called an auditory trainer to kind of help with auditory filtering for kids with autism spectrum disorder, and we're finding that this app is very helpful for them, and so hopefully maybe that might be available soon. Just some key terms throughout the presentation. A lot of people probably don't know what an audiologist is. We do work closely with speech therapists back in the United States, but we basically assess hearing and balance disorders. So mainly today what I'll be talking about is hearing disorders or hearing impairments. This doesn't necessarily mean that the child has a hearing loss, but possibly they have some kind of auditory deficit that's causing them not to process auditory information well. And we find that a lot of kids who have autism do have some kind of auditory deficit, and the remote technology that I'm talking about is pictured at the top, and that's some of the technology that we use with our kids with autism, and we find, and I'll show you some research on what we found, is that this was very helpful for listening comprehension and a lot of other things that I'll get to. I'll kind of skip through the rest of the key terms, but I'll hopefully explain them as I go. I was going to kind of go a little bit of the hearing process, but I'll briefly explain this side. We have an outer ear and a middle ear as well as an inner ear, and all these different parts are how we kind of process sound. So you might have a problem in the outer ear, or you might have a problem in the middle ear or in the inner ear, and how we diagnose and manage those types of hearing loss are dependent on what kind of hearing loss or deficit that the child has. I also want to mention that we are hearing with our brains, and so in the last circle, the inner ear, you can see an orange nerve, and that nerve actually sends auditory information to your brain. So you can have perfectly good hearing and hear all the way up to that point, but if you can't process that auditory information, you can't use that information. And if you can't use auditory information, you won't be able to develop good speech and language. So that's something important that we need to consider when we're working with this kind of population. So again, what exactly is an audiologist? It's someone who diagnoses and manages non-medical treatment of hearing and balance disorders. We work with normal hearing individuals as well as impaired hearing individuals. And what we do to kind of minimize these impact of this disorder is we recommend hearing devices or hearing assistive technology, which is what I'll be talking about in this presentation. And why does this matter? Why do we need to kind of address this hearing problem? Well, if you don't have hearing, you're unable to develop good speech and language. So if you're not able to hear the sound, you're not able to produce the sound. And if you're unable to develop speech, then you're not going to have good language capabilities. We know research has shown that language deficits causes learning problems. To develop language, then you know your neurotypically developing child. And then these communication difficulties, they lead to social isolation. So if you have communicate and you're not going to go out and communicate with people just because they're unable to understand you and you're unable to communicate effectively. So this in the future might have an impact on vocational choices, jobs that you can do, and just basic functioning in society. So this is just kind of how we address hearing loss in the United States. We go through a hearing screening. We want to fit them with hearing technology within 1 month, just because we want them to develop at least one word by age 1. And throughout this whole process, you're not just developing that one word when you turn 1 year old. It's a process of hearing all these sounds that people are around you, your mom talking to you, you hear all those sounds. And once you hear the sound, you're then able to produce the sound. So early intervention is important. Then we also go through hearing assistive technology. And again, that was the device that I showed you earlier. We typically fit those with children who have hearing loss, but we also do it with children who have normal hearing. And we fit these devices for normal hearing children when we're concerned about their attention, if they're hyperactive, if they have difficulty integrating sensory information, behavior problems, cognition, processing. So that's why it's important to have a hearing screening. There are difficulties we encounter with kids with something communicate, learn a child. So condition that different pitches. So they'll hold the block up to their ear, beep, 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 then they'll throw the block in the bucket. This is just kind of some techniques that we use to test kids who are nonverbal or who have autism spectrum disorder. So some techniques that we use, again, we try to minimize any kind of distraction that's in the environment. We bring a partner or a family therapist. This way they have some kind of sameness when we are doing testing. Sometimes I'll model the behavior on their stuffed animal or their parent first, just to see that it is safe, it's not going to hurt, and then continue, for the child. So in this picture, this little girl is just looking in the ear. That's one of the first things that I want to do when I am assessing a child, and so I let her do it to her stuffed animal first, and then I'm able to do it in her ear sometimes. And then finally, we just want to make sure that you don't give up. Sometimes it might take multiple sessions, but you just try your best. So these are just some auditory deficit characteristics for kids with autism spectrum disorder, and I just kind of go over this briefly, but we did multiple surveys with parents, and we found that their child who has ASD is often distractible, can't function in noisy places, or they're unresponsive or have poor attention to auditory stimuli or auditory sounds, basically to speech. We also found that their ability to filter out auditory signals is the most significant predictor of educational performance. So their ability to reduce all the background noise in the room and to give emphasis to the signal is a good predictor of how well they'll do academically. They also have poor speech recognition and noise, so when the environment is noisy, they're not able to listen as well as normal individuals. Normal people, they have so much they're listening to the ASD. And there's numerous reasons. I won't get into technical and a lot of research, so I'll kind of just summarize, but this is basically the research showing that they do listen, how a normal, typically developing child listens in noise, and these are actually brain responses that we measured. Sorry that I can't go through it, but just kind of go through these. This is a really cool study, and I won't go too in depth, but basically what the researchers found was that there's a pruning effect when you're born, and as soon as you make patterns to things, you're actually pruning and making, you're reducing the amount of dendrites you have. And I know this is really technical, but basically to summarize this slide, kids with autism spectrum disorder, they don't necessarily prune their dendrites when they're making patterns, and so there's an oversensory stimulation for them. And this is likely the cause of difficulty separating signal from the noise. So it's just very hard for them to concentrate on speech and to eliminate all the background noise, something that you and I kind of do innately. And then they also have to struggle with coexisting disabilities. So we all know that it's not just autism spectrum disorder. Some of them have attention deficits, learning disabilities, language disorders. They're having to go through all of this while also being encompassed under the ASD umbrella. This is research with the technology that I was talking about earlier. We had 11 children who had autism spectrum disorder and then 11 typically developing children. And they were fit with these devices. The purple device actually goes behind your ear, and the gray dome goes in your ear. And that picture where the teachers scores. So if you don't have FM technology for your kids with autism, you do severely worse. But then we found that when we do put that FM technology on the kids with autism, they actually perform similar to your typical developing kid. So now we've made it a level playing field. Now they're able to process this speech information just almost as normally as a normal, typically developing child. Then we also measured on-task behavior. So we measured how much % of the time with these remote microphone technology is the kid on task and not being distracted. And we found that with FM technology or with remote microphone technology, the kid actually stays on task better than without the remote microphone technology. So again, that plays in with the attention piece. Bringing the signal right into the child's ear really plays an effect on their attention, and it benefits and increases their attention capabilities. We just finished another study when we actually assessed so the last study was with numerous disabilities, autism spectrum, attention deficit disorder, multiple disabilities. This current one that I'm going to talk about only dealt with kids with autism spectrum disorder. And this again is that speech recognition. We found that with the FM device, they're actually improving their speech recognition significantly. We also wanted to take a step further. We wanted to see how much background noise they could tolerate. So actually this again, a lower score is better, but they were actually able to tolerate more background noise when they had this remote technology on. So they weren't as sensitive to noise or as bothered by the noise when they had this technology. We also wanted to assess listening comprehension. So not only are they recognizing speech, but can they comprehend? So we had some tests. They were simple tests. We tested immediate memory. We asked questions like, say these after me, 93758. So what they had to repeat was 93758. Then we also tested recent memory. What is the name of your school? What grade are you in? So we used this test to assess how well they're doing comprehending speech stimuli. And we also found that with the remote microphone technology, there's a significant improvement in listening comprehension. So it's not just that they're able to repeat the word, but they're actually able to comprehend what you're saying and answer these questions correctly with this technology. Then we also wanted to ask the teachers their opinions. Actually, this was for the participants. So we asked the child, those who were mid to high functioning, who could answer these surveys. And I won't get too in detail with this just for time's sake, but we also found that they reported less challenges when they had this remote microphone technology. So I'll go back, some of the questions that we asked, we kind of modeled. The teacher is talking in front of the class and the kids are quiet. Everyone is watching and listening to the teacher. How well can you hear and understand the words the teacher is saying? So then we would show them this picture and kind of give them this scenario and they would rate it. It's always easy, which was a 5, or it's always difficult. And this is kind of how we assessed that with this graph. Then, we also give a similar survey to the teachers, and they also found improvement when they had the remote microphone technology. And this is that picture up there. You can kind of see how the teacher wears the device. You wear the transmitter around your neck, and then the black part clips onto your shirt or a scarf that you're wearing, and that's the microphone, and that's the signal that's being delivered to the child's ear. We also did another survey with the teacher. I'll kind of skip over this. We also asked the parents to give us some subjective opinions about the remote microphone technology, and we found that auditory filtering, which before I said was the #1 predictor of education or academic success, we found that that significantly improved with the remote microphone technology, as well as auditory and visual sensitivity. This is another parent survey. We found that, across the board over most categories in quiet, noise, and distant situations, as well as in social situations, the remote microphone technology was also subjectively beneficial, as reported by the parent. Just to summarize, early diagnosis and intervention is essential. There's significant behavioral improvements with remote microphone technology, so better speech recognition. They're able to understand and get that auditory stimuli right to their ear, so they're better able to recognize speech. They accept higher noise levels, so they can function in noisy situations, even though that usually is pretty hard for them. And it improves listening comprehension. So it's not just that they're repeating the word back to you, but they're also comprehending what you're saying, and that's also improved with this remote microphone technology. Subjective improvements are also present. The participant reported that it was less difficult listening in the classroom, and we all know that classrooms can be pretty noisy when you have multiple kids in the classroom talking, ruffling through papers. The teacher also reported that the child had less difficulty in the classroom in quiet situations, noisy situations. They also had improved auditory memory and auditory attention. And the parent also reported improved auditory filtering. So again, that's filtering the speech from all the noise. They had less adverse reactions to sound. So sometimes sound stimuli can be a little overbearing for our kids with autism spectrum disorder. But this remote microphone technology kind of introduces that sound to their ear, so they're able to have a less adverse reaction to sound. They also had less listening difficulty, again, in quiet noise at a distance, as well as in social situations. And just briefly, I just want to highlight some emails that we had from parents who who participated in this study. I know you can read it for yourself, but I'll just kind of briefly go over. This parent emailed us. She had one child in the study. She said, "I've just finished using the devices for the first time today, and my daughter and I just had a 3-minute conversation about Coco. She made eye contact consistently while we talked back and forth, and she responded quickly as I've never seen her do before. Afterwards, we continued with our conversation some more. Usually a conversation with her requires a lot of work with repeated requests, questions, etc., as many as 10 times to get her to respond. And keeping her engaged and having an ongoing conversation with her is taxing. However, the conversation that I had with her just now was super easy. Because of that, I'm so amazed and excited." So that was with the remote microphone technology. And this next email was a parent. She had 2 kids with autism in our study, and she reported they are doing so well with them. The teachers are giving some great feedback. We actually tried them Sunday when we went grocery shopping at Target, which is just a grocery store grocery store in the United States, and it literally brought me to tears because it's the first time in years we've all been able to go and they listened. I would talk to them and remind them how we behave while we were in there, and having my voice talk them throughout, they actually helped put things in the cart. So this mother just reported that technology really helped, grab their attention, and she was able to give requests and they were able to follow through with that. Another teacher actually reported that one of her kids did not really have good social interactions, and she never really talked with anyone in her class. But the teacher one day was wearing the mic, and just for presentation's sake, let's say this child's name was Grace, who had autism spectrum disorder. And one of her friends said, "Good morning, Grace." And as usual, Grace didn't respond, but the teacher told Grace through their microphone, Mary said good morning, and Grace actually replied good morning. So it's just amazing what this remote technology can do, and it's interesting to see maybe long term how this is actually helping neurologically with the child, but definitely preliminary studies are showing that it's just great technology to use with kids who have autism spectrum disorder. And that's the end. I just want to thank everyone for listening. And if you have any questions, please do ask me at the end. Thank you.
Hello? Hello? Hello, can you hear me? Okay, thank you very much for that, Ms. Susan Wright. Really appreciate that, presentation. Just to let you know that these presentation slides will be available on our website, www.gtbank.com/autism. So we have an opportunity for a Q&A, literally just one question for each one of these ladies, please. Do we have any questions? Okay, just hold on, please.
Good afternoon, everybody.
Tell us who your question is directed to, please.
Okay, my question goes to Susan. All right, from the presentation, you said we hear with our brains. Now, for a non-autistic child that doesn't have the outer ear, the one we can actually see, I want to know, does it actually affect the hearing process? Then for an autistic child that doesn't have this, how do they use the device you just showed us? Because you have to put it around your ear. But I was watching something on YouTube yesterday that you have to place it very close to the ear, but on the head. Mm-hmm. Does that work well? Thank you.
Yes. So for a non-autistic child who doesn't have an ear, the outer ear is what we kind of call a pinna. They might still have that organ of hearing inside of their head. So we actually fit a device that vibrates on the skull of the bone, and that actually stimulates that organ of hearing, is what we call, and they can hear kind of like a normal hearing child does. So it just depends on what kind of organs are there, and we do testing to determine if that child can hear with that bone vibrator on. And then your second question again. Okay, so we can also fit what we call, it's called a bone anchored device or a bone vibrator. We can also fit that on on the kid with autism, and it'll work just like this technology. It's just a different fit for the child. Thank you.
Thank you. Okay, we have one more question for Ms. Leah, preferably. For Ms. Leah?
No, for Ms. Susan. I've already taken my son to Yaba to do the audiological test. But I thought I didn't need this lesson, but this is the most forward thing I've ever heard. So how can we assess this technology here right away? Because it's like we need it like yesterday.
I know. And I was actually working with my professor who supervises the research to kind of bring some technology here. But actually, if you do take down my email, we have contact with a manufacturer, and hopefully and eventually we can bring some technology here, or we're able to kind of distribute that technology for a trial period.
Okay, we have a question for Ms. Aliyah.
Good afternoon. Aliyah, I have a child I'm working with. She has ADHD. And she's very interesting.
Aren't they all, though? Let's be honest.
But at the same time, she appears very difficult.
Sure.
So, as you spoke, I tried to fit in your method into my method of teaching her.
Okay.
And as I sat here, I tried to teach her using your method. And my psychic, I'm like, I don't think this is going to work for her. Because for every question she answers, and you tell her something wonderful, like you reinforce her,
sure,
she's probably going to tell you, oh, I knew you were going to say that.
That's fine. Then don't verbally reinforce that kid. Just use edibles, or just use, so I sign, it's something I grew up doing and something I still use. Use high five, use a fist bump, all of those things are, you can even like a foot five is great and quiet, and something that child has to sit down for. So if that kid is not gonna respond well to verbal praise, that's fine. Use something else. And you know, kid to kid it's different, and know that you can develop something special with that child, something that just she responds to. Like I had a kid who, my deal is like, give me 1 5, give me 2 5s, give me 2 5s at the same time, great job. So I only did that with one kid, and she loved it. It was like a secret handshake. So I know it sounds silly, but know that kid, knowing that they're special to you, is so important that is reinforcing for them. Thank you.
Thank you very much. Thank you very much, Ms. Aliyah and Ms. Suzanne Rice. Really appreciate that. Okay, so it's now 3 o'clock. It's lunchtime. Late lunch, unfortunately, but it's lunchtime. So please, the ushers are ready to direct you to the different food areas, just like this morning. So we have a break for, okay? We'll reconvene today. And don't forget, the BVN, please do go and register for BVN. Thank you.
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about everything to make your dream come true. Everything is you. I believe that I can be all of the best in whatever I do. Guaranteed to take the lead. All of the best in whatever I do. Guaranteed, yes indeed. All of the best in whatever I do. Won't you take my hand and let me lead? Would you rather trust me? There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best in what I've got. Just trust me. Wouldn't you take my hand and let me lead? Wouldn't you rather trust me? Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. We care about the things you care about, and we can make it happen for you. We aim to please, to reach the guarantees, trust that we'll be waiting for you. Welcome to the future. Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes, the best. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about everything to make your dream come true. Everything is you. I believe that I can be all of the best in whatever I do. Guaranteed to take the lead. All of the best in whatever I do. Guaranteed, yes indeed. All of the best in whatever I do. Won't you take my hand and let me lead? Would you rather trust me? There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best in whatever I do. Guaranteed to take the lead. One of the best in whatever I do. Guaranteed, yes indeed. Two of the best in whatever I do. Would you take my hand and let me lead? Would you rather trust me? Would you rather trust me? Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. We care about the things you care about, and we can make it.
Hello? 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 Hello, everyone. Hello, everyone. Okay, just to remind you about the last two programs that we have for today. Okay, you can continue eating, just listen. Okay, so we have the speech therapy techniques for success. Speech therapy techniques for success. Hello? Okay, that's better. Okay, so we have another two programs to go, which are going to start at 4 o'clock. The first one is going to take place in here, which is Research Trends in Autism and Related Disorders by Dr. Sonia M. Armstrong. So that's going to take place in this room. This is the Shell room. It's going to take place between 4 and 5 o'clock, just to give you time to eat. The other program is going to take place in the Ajip Hall, which is Speech Therapy Techniques for Success. That's going to be hosted by Miss Denise Hetherington, speech therapist, Chicago City Schools. So please, again, remember to keep all your valuables with you at all times. Do not leave your valuables unattended. And please, if you're remaining in this room for the next program, please come forward. Just come forward and close the gaps that we have. And if you need to be in the other room, you can always start to make your way to that other room now, so that you can eat and wait as you're waiting for the presentation to commence. Thank you, everyone.
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone, where the smile will warm your heart, and the people think about everything to make your dream come true. Everything is you. I believe that I can be all of the best in whatever I do. Guaranteed to take the lead. All of the best in whatever I do. Guaranteed, yes indeed. All of the best in whatever I do. There's a place I long to be, where the air is wild and free. I can let my hair down and be me, wouldn't you agree? I believe that I can be one of the best in whatever I do, guaranteed to take the lead. One of the best in whatever I do, guaranteed, yes indeed, to be the best in whatever I do. Wouldn't you take my hand and let me lead? Would you rather trust me? The super ever does. Would you take my hand and let me be? Would you just trust me? Would you take my hand and let me lead? Wouldn't you rather trust me? Step into the future, even today. The world never make come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. We care about the things you care about, and we can make it happen for you. We aim to please, to reach with guarantees, trust that we'll be waiting for you. Welcome to the future, Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
Okay. Hello, everyone. Hello, everyone. Okay, so I've managed to convince the consultants to start a little bit earlier. So they're just upstairs eating. So give us like 10, 15 minutes and we'll start the last program. Is that okay? Yeah, okay. Thank you.
There's a place I long to be, where the air is wild and free. It's a little haven just for me. I can let my hair down and be me. Just a smile for a start, and it only takes a spark to begin the fire in your heart. Wouldn't you agree? I believe that I can be only the best in whatever I do. Guaranteed to take the lead. Only the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. There's a place not far away, where the sky is never gray, orange as the evening setting sun. A place that has a friend for everyone. People through. Whatever I do, guaranteed, yes indeed, one of the best. Whatever I do, won't you take my hand and let me lead? Would you rather trust me? There's a place I long to be, where the air is wild and free. I can let my hair down and be me. Wouldn't you agree? I believe that I can be one of the best in whatever I do. Guaranteed to take the lead. One of the best in whatever I do. Guaranteed, yes indeed, to be the best in whatever I do. Would you take my hand and let me lead? Would you rather trust me? Would you rather trust me? Step into the future, even today. Welcome to the world where you have a say. We can make your dreams come alive. Just come take a dive with me. We can change the world with a smile, so just set your mind at ease. We care about the things you care about, and we can make it happen for you. We aim to please, to reach the guarantees, trust that we'll be waiting for you. Welcome to the future. Guaranteed Trust Bank.
Guaranteed Trust Bank. Wouldn't you rather bank with us?
Hello, everybody. Okay, so we have the last presentation now, which is research trends in autism and related disorders in Nigeria. This is going to be presented by Dr. Sonia Armstrong. She's a professor and Fulbright scholar, Department of Mathematics, West Virginia State University. Can you please move forward, please? Can you please just move forward just to close the gaps? Exactly. Exactly. Okay, you've got your point.
No, I don't think so. Oh, okay. It doesn't have that.
Thank you, everyone. Would you want the thing? Do you want this? Or do you want
Yeah, I'm
that?
going to need this. I'm going to be moving.
Okay.
I had my little thing that told me how to say good afternoon in the language. How do I say it
in
again?
Yoruba,
Mhm.
I only know how to say ekason.
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 Ekason. Afternoon. No, I only know Ekaso, so you'll have to tell me something else that I can say if you did not understand that one. Efele? 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 I am happy to be back. I am part of the first team, and I've never missed one of these trips. And each time as I prepare to come, I'm like, wow, what am I going to be doing? They probably get tired of seeing me. I do not have anything new to say. And every time I show up, I'm more invigorated by the progress I've seen. When we started in a small hotel room, 250 participants and presenters in all, and now 1,000. So I am really delighted to see kids and parents showing up and having the awareness. What I'm going to be talking about today is the need for us to have data. We heard a lot of things thrown about all day today, and usually we'll say, where's the data to back it up? And so we need stuff. So I'm just going to be going briefly, talk about what's going on, what have they been researching, repeating some of the things you have already heard and some of the things you already know. So a brief review of the literature on autism, evidence-based treatments, what works, what does not work, or need to be retested, what needs more research, and the need for data collection in Nigeria. So I have a quote, and it says, look deep into nature, and then you will understand everything better. And as we think about the child who is presented with autism, looking into nature, we can get an understanding of what is going on and how we can best help ourselves and the child. I do not know of anyone
who does not have any first-hand experience with an autistic child. I think most of us who have come as presenters have relatives or we are teachers of people with autism. I have colleagues with children with autism, and I should let you know that my coming here has really improved and increased my awareness of autism, because I'm a math professor, and mostly what I do is to teach the students who are going to be going out to teach and teaching them how they need to be presenting. And now, having participating in these workshops for the 5 years, I'm able to now put that part in my presentations to them to help them better deal with their students. Sometimes only a change of viewpoint is needed to convert a tiresome duty into an interesting opportunity, which was said by Albert Flanders. And that's what we need, just an opportunity. And as we think about our sign with bridging gaps and transforming lives, and I must congratulate you in Nigeria for bridging this gap and transforming new lives in having a new president and a really good transition of power. That when I was coming here, someone gave me a U.S. international article that is talking about this and giving the hope that the world has for Nigeria and looking at Nigeria in a new light. And this that we're doing with autism is going to fit right in, that we collect and make sure that all the parents and the children are part of this new government initiative. So some historical background. The term autism was used over 100 years ago, and in 2012 we came and we were celebrating our 100th anniversary. And it was used by a Swiss psychiatrist, Eugene Blur, and he used the term to reference a group of symptoms of schizophrenia. And auto, or autism, comes from the Greek word auto, meaning self. And as you are aware of people with autism, they're mostly internalizing their actions and their things, and sometimes what's called an isolated self. In the 60s, Dr. Leah Kanner and Dr. Hans Asperger in 2 different continents were working on autism at the same time independently, and you probably will recognize the word Asperger, from which the name of the syndrome, the high-functioning autism, is referenced. So in 1940, the researchers in the United States began to use the term autism to describe children presented with these emotional or social problems. And Dr. Leo Kanner, a psychiatrist from Johns Hopkins University, my alma mater, and Hans Asperger, a scientist in Germany at the same time, then autism and schizophrenia were linked until in the 1960s that they decided to have their own clinical view of what it is. Autism is the most severe developmental disability appearing within the first 3 years of life. It involves impairment in social interaction, such as being aware of other people's feelings, and verbal and nonverbal communication. Some people with autism have limited interest, strange eating or sleeping behaviors, or a tendency to do things to hurt themselves, such as banging their heads or biting their hands. And this is adopted from the Encyclopedia of Psychology. And most times that's the only time, or the first time, one observed throughout literature, autism is a childhood disorder that typically appears during the first 3 years of life. It is a pervasive process information socialize, communicate, information, and experience a full range of interests common to most people. A review of the literature shows that autism is present in every sector of the larger community, every continent, every walk of life, every socioeconomic group, every ethnic group, every racial group, every height, all of those. So there's no one thing physically that you can use to define the autistic child. Research is being done all over the world. It's a global effort because this is something that people cannot understand. And you heard all the speakers before me talk about different things that are coming up and what they're looking at as a brain disorder. Most of the research is being done in the United States, the United Kingdom, Canada, Germany, Italy, Japan, Australia, as I said, everywhere. But what is missing is a big part of the literature is that there's not much coming out of Africa, and especially sub-Saharan Africa, where we're doing things, but we're not presenting it or writing about it. And in order for it to get into the science journals, you have to have research base. Hence, the purpose of my presentation. The most frequently researched topics have to do with diagnosis and treatment. But they're different topics, as you heard people talking about different things, looking at the eye, looking at toxins, looking at foods. But some of these can be eliminated because since autism is all over the world, we cannot say that it's because people are eating yams or it's because people are not having their vitamins or it's because people are getting vaccines or because people are rich or because they're poor, because those things are disputed because autism falls under such broad umbrella that you cannot pinpoint it to those things. So right now, they have concluded that it is mostly neurological disorder, type of, and that might be the China not want the to see how happening there. The biological and the environmental. We heard about toxins, heavy metal mercury, and we always, in the United States, they warn all pregnant women or people wanting to be pregnant to stay away from having a diet of fish because of the heavy content of mercury. So those things have been fully researched, have been fully linked to autism disorder. Those have been researched over and over and are clearly identifiable, but they have not identified is for this disorder. Treatment is another big part of the research, and the most discussed or used treatment is early diagnosis and intervention. That is primary, that is a primary evidence and the primary thing and the most effective thing one can do if a child is suspected of being on the spectrum is to have early diagnosis. Then there's applied behavior analysis, which Leah spoke about, and you'll hear more about later. And then there's a SERTS model. That's a new model that's it's research, but it's not as big as the previous two. Early intensive behavioral intervention consists of 20 to 40 hours per week of individualized instruction for children with autism who begin treatment at the age of 4 years or younger and who usually continue for 2 to 3 years. And this is a UCLA model, and it's one of the EBI model, and emphasizes instruction at home with discrete trial training. Other models provide instruction in classrooms. Some emphasize teaching methods other than discrete trial training, such as incidental teaching. A number of scientific studies indicate that EIB may produce larger gains in development and reductions in the need for special services. However, these studies have involved small numbers of participants and have had other design limitations. And so there's still more need for that to be studied. So those of you who are practicing that need to collect data and try to have information to add to the literature. ABA, which is one that most people know about, is the Practitioners of Applied Behavior Analysis. It aims to improve socially important behavior by using interventions that are based upon principles of learning theory and that have been evaluated in experiments using reliable and objective measurement. It's the most researched, most validated form of treatment for autism. And in 1999, the United States Surgeon General concluded that 30 years of research demonstrated the efficacy of applied behavioral methods in reducing inappropriate behavior and in increasing communication, learning, and appropriate social behavior. The SERTS model was developed by University of North Carolina and other professionals. It provides a framework for improving communication and social emotional abilities in preschool and primary school students with autism spectrum disorders, and it also provides service for their families. So this is probably going to be quite controversial. What does not work? Or what has not yet been researched or enough evidence to show that it does? Animal therapy. And this is having children interacting with animals. Therapeutic horseback riding, dolphin therapy, or pet therapy. There have been no scientific studies of animal therapy for individuals with autism spectrum disorders. So, as with anyone, having an animal around is very good, but don't go just buy your animal just because you want it to treat your child. It would be good for you, good for the child, but it has not been proven to be an effective treatment. Art theory, therapy, this should have been therapy, it refers to the application of art with the intent of enhancing functioning, and proponents believe that art therapy creates visual images that may represent thoughts and feelings and can be used to help individuals express thoughts and feelings, and that may be too difficult to express verbally. The art therapist uses a variety of materials such as clay or paint, fingering, and all of those things. Access to such activities may be used as a reward. This is different from art therapy, in which the art activities themselves are viewed as therapeutic. So having an art project with your ABA is useful, but to use that as a solely artistic therapy is not effective and has not been evaluated scientifically. Auditory integration therapy. And this is an intervention in which the service provider identifies sounds to which a participant is believed to be over or undersensitive. Then music with selected high and low frequencies is presented via headphones, which is different from what Ms. Wright presented. So, but all of these things are, so auditory processing training, speech sounds are dilated or expanded, and it's presented more slowly than in typical speech, and then compressed as the student progresses. The 2002 American Speech and Hearing Association work group on AIT, after reviewing empirical research in the area to date, concludes that AIT has not met scientific standards for efficacy that would justify its practice by audiologists and speech-language pathologists. Food therapy. This is alteration of the participant's food intake of the purpose of changing behavior. Many diets involve eliminating substances from the participant's food intake. Gluten-free, casein-free, sugar-free, dye-free, all of those things can affect someone. I have allergies, and recently I found out that I was allergic to the dye that they use to test you. I have, we have nut allergy, and so allergies are all over, but food supplements, nutritional supplements, those have not been scientifically researched and do not have any effective methods of curing autism. Now, doesn't mean that it cannot be researched, so studies will need to be done to show that it is useful. Omega-3 is a very effective supplement for everyone. I take omega-3. I use omega-3 to control my cholesterol. But if I were just to use that, that would not be a sole effective method. So, not stepping on anyone's toes or anything, research needs to be done if we want to go about talking about foods. Supplements are good. It's good for everyone. And so we talk about toxins in the body. We do not know whether or not these toxins are there prior to being tested, or as a result of being affected with autism, these other things interfere with the inner ear problem that we heard talk about, or the food intake that is within the body. So that has not been proven. And I have a list of all the research that has been done. Additional study of the theoretical basis and efficacy of the diet is warranted. And there's a risk that removing gluten and casein from an individual's diet will lead to inadequate nutrition. So that's very important, that you do not go around removing things from your child's diet without having proper verification and working simultaneously with your pediatrician. There are no scientific studies on other dietary interventions for children with autism spectrum disorder. So, why do we need to collect data, and especially research in Nigeria, as I mentioned earlier? we do not have enough research coming out of Nigeria. And like in America and in some other countries, like Latin countries, we have a tendency to believe in supernatural things, superstition, it's there. And so studies need to be done to show that you cannot pray autism away. Just like you cannot pray LGBT away, even though some people would profess to say that they do pray it away. Oh, homosexuality. That's what I'm talking about. There are people who advocate praying it away, that you can pray it away, you can lay your hands on someone and heal them of this. Just like you cannot do that, you cannot lay hands on the autistic child and pray the autism away. There have not been any studies to show that. Now, now, actually, what has been shown is that there have been instances where there have been situations where per groups and per people have been praying and the child has been suffocated. So, not to step on your religious belief, it is not a curse, it's not an X on you, because you would have to imagine how many people all over the world have all these X's on them. We could have a movie called The X-Men or something, or The X-People. So it cannot be prayed away. So we want to take the myths, spiritual issues for birth defects. There's no study to show that autism, a cause of autism is from bad actions. So you cannot blame yourself if you're a parent that you did something bad. Because we saw over 1.2 million people in Nigeria alone, over the same in, millions of people all over the world. They all did something bad to create this behavior for their children. No, that's a myth. It is also not a cause inflicted from someone you owed money to and you didn't pay them back. No, they did not do that to your child, nor did they do it to you. So don't believe that. Mental health and intellectual disorders can be found in the spiritual realm. And we know, those of you who are religious, you know that our Jesus person, he did cure a person who was demon possessed. But autism is not a demonic problem, as far as we know. But it doesn't mean that you cannot do research to show that it is. So that's why we need to collect all this data, put them together, and then we can have those things. We know that there have been cases where families are blamed for the female. Now, interestingly, latest research is showing some indication that the older male could be a contributing factor, but that too has not been fully researched and is not yet fully documented. So we heard about some person who, after dying or whatever, I thought I heard it this morning, brain dead and got back up and had 2 children. But these things can happen. They're isolated events. So, but we have to collect the data, and if we have enough of these documented, then we can put it out there and we can show that anything, we are always trying to hold on to any piece of hope. You know, we can never lose hope, so we need to document whatever methods we have found. So we do not think it's a female trouble. So, the report, another reason why we need to do this research, report from the Surgeon General, UN Secretary General, found that while all children are at risk for being victims of violence, disabled children find themselves at significantly increased risk because of stigma, negative traditional beliefs, and ignorance. The violence are of two sources: violence within the household and violence sanctioned by society. We need to do research to help family to have the comfort to know that they are not to be blamed for having an autistic child. So, among the household violent manifestations are infanticide, and mercy killings. The first year we came, during our presentation, we had report of somewhere, I think up in the north, where kids were killed. I do not think they're having these anymore, I do not know. But do not blame yourself. We have to do the research to show that it is not a personal thing. Physical violence, sexual, emotional, or verbal abuse of the disabled child in a violent household. So you can imagine with a child who is autistic, not having the hearing, how easily it is for the abuse. The theory of child-induced stress leading to violence. Neglect as a precursor to violence. Violence and abuse linked to social isolation. Abuse by support staff within the home. And I know that none of you as behaviorists would do any of these things because you wouldn't be here. So we applaud you for being here. You know that it is not these isolated events, but you want help, and that's why you're here, and that's why we need to do the data collection, to do the research. Socially, in the society, there's lack of consequences for abusers, lack of knowledge about disability within the legal system, hence the awareness of this conference, that this conference brings. Once you know about this. When I first came on my first visit, I visited the Patrick Speech School, and there was a young child playing the piano, and I went and I touched the keys, and he just whacked me. And I just straightened up, and I put my finger on it again, and this time he whacked me a little less, and then I put it again, and then he just touched me, and a fourth time I put it down, and he just ignored me. Because I did not run away or jump and be scared. He realized that I was not really taking over his space, and I was not afraid of him. And that is what awareness brings, and that's why we need to have more data to show these things. We have virgin rape and the AIDS epidemic, we have seen that. Exorcism, I mentioned earlier. Unnecessary or unproven surgical and medical treatments. That's abuse. So, what are some of the things that needs more research? We need, some studies suggest that simply placing children with autism spectrum disorder in settings with typical peers without any other intervention may increase their social interaction. But other studies have not shown these effects. Thus, additional research is needed on whether simply placing children with autism in settings with typical peers is effective. I heard Ms. Akonde talk about that she works with her students, they help them, and then they send them off. My neighbor in the United States who has a school, they send their children off, they work, and then they have a follow-up with them. So the child can always return to the school if there's a problem or if they get into difficulty. I know Blazing Trails work with groups, and they have supports people to go out with the kids. Marshall University in West Virginia, they have an adaptive behavior program where your student can go to the university and they have wake-up calls, they tell the student when to get dressed, what to wear, and all of those things. Those are behaviors, those are things that are needed to help. But still, not enough research is there. We need data to have children screened for developmental disorder, and we're going to be doing some of these screening later and collecting data. We need to assess the comorbidity. Last year, I presented on the findings that we know that most children with autism are faced with some other type of disorder. What is not known is whether or not, what comes first, because autism is a secondary diagnosis. You are not first going to your doctor and the doctor, the first visit is diagnosing autism. You're presented with something and the doctor in testing and evaluating gives you a new diagnosis. So those are things that need to be evaluated. We need changes in diagnosis, and that has happened that in 2013, we have the new research that came out that showed that there are some things that came off the spectrum, and that there are 5 things that needs to be included in order to be considered. Trying to find my notes here. So research and data collection changed to the DSM-5, increasing diagnostic validity and clinical utility. So the 5 things: very severe, severe, moderate to mild, fixated interest, repetitive behavior. And then they came up with pervasive development disorder, PDD, as a diagnostic criteria with 5 subtypes: autistic disorder, Asperger's disorder, Rett's disorder, childhood disintegrative disorder, and PDD, NOS, not otherwise specified. So these evaluations and clinical terminology came about as a result of more research, and that's the reason why we need to collect data and do research to add to the literature. We need to do research to reduce the stigma associated with autism and related disorder. The more data we can show that there's no connection to vaccine, no connection to malaria, no connection to born on Wednesday, no connection to going to church every Sunday. Once we have those and we can collect data and demystify those things, we are better able to focus on treatment and helping the child to adjust to society. As far as we know, there have been no known cure for autism, But what is known is that the autistic child can develop into some sense of normality where they can live and do most normal activities. They can go to the university, they can get their degrees, and so we need to have research so we can focus on that. Still, there's nothing wrong in searching for a cure, but right now there's no cure. So we need to focus on treatment and helping. Research is needed for changes in governmental policy. We heard about the bill that was sent to the legislature in our first year, and the second year we got here, the senator from Abuja had gotten some bill passed, but we do not know where that is. In the United States, a number of initiatives have been developed only because data was collected to show the disparity among things, among women being underpaid, among others, African American students not excelling as much, not because they were not smart, but because they were given less attention in school, less books, less schools. We have Title IX, where girls' sports have become a national thing. All of that because of data to show that female students were being underrepresented. We have policies in the United States, not every state, but in the state where I am living in West Virginia, our parents with autism, they had a group and they were able to get the legislator to pass legislation to ensure that the insurance company covers the care for autism. Because you know that if you have an autistic child, you're going to need that help. And insurance, we have what is called flex, amount of money that you can take out and have that pay. All of these things, they do not just come about because someone in the government or a friend said, okay, do this. Data is collected to show what has been done and what can be done. We have a new government, new president, and we're looking forward to having good report and good moves. And this is the ripe time for us to have some data to present on what we have been doing and the need for us to have that legislation passed. So we need to get that while he's still fresh in office. We need to have that to have procedures to support protocol, to give hope where there's hopelessness, and to fund programs. If we're going to be writing grants, which we need to do or start doing to get support, we've got to have data to back up what we are saying. We have to have that, and that's why the need for data collection. And I would like to thank Blazing Trails International, Gtbank, and my West Virginia State University for allowing me to be here. And that's it. I will answer any question. Yes.
Okay. Any questions?
All right, good afternoon. My name is Buega. Thank you, Doctor, for a very informative presentation. My worry is the fact that I'd expected we'll have data collected in the last 5 years to show where we started and then where we are, then for more insight into what we should expect when we would have gotten a lot more people aware of this particular initiative. I don't know why we didn't see that, and I thought we should be able to get that one. Thank you.
I made, and I ask, can you hear this? No. That we need to have that. We have been here 5 years. We need to have enough data to show that this is an impact. And unless we have that, we cannot take it to the legislature. We cannot take it to Microsoft or Bill Gates. They have money. And if we can show some stuff that we're doing here, we can write for them and ask them to support some of these things that we have, to give scholarships to students to go, or to get a center. We talk about that resource center. It needs money to do that, and we have to have data. We have limited data, but we're starting to collect that, and we're going to be trying to put together a documentary that we can show to use that for everyone. Thank you. And you can collect your own data if you're a behaviorist, if you're a therapist. Collect your data from your student from the start they start. Look at what they do every day. Collect that, have that, report that, and we can use all of those. Do that. I am a statistical consultant to Blazing Trails, so if data is sent to them, I can do the analysis and I can write it up and get it back to you. So that's my role in this whole picture. There's another question?
Thank you, Prof. Since morning, it seems to me that much of the presenters were practitioners. So I've been looking forward to this privilege where I will see an academic presenting from the viewpoint of research and presentation of what research I've done so far. My view or question to this presentation is looking at the commercialization of what has been done before and seeing how we can now allude it to its usefulness with people within the spectrum of autism. But before we can do that, Nigeria has some peculiar features that I think should not escape our notice. The school curriculum in Nigeria is, first of all, defective. We have people in clinical psychology, we have people in child psychology, we have people in clinical psychology, we have early childhood education and development studies, then we have people in mental health. All these people mostly don't feel concerned so much. Their training doesn't go into really working with the child himself or the child herself. But most of the theories that we learn seems, if applicable, they are archaic. So if we are now bringing in what we've been taught in schools at this time, it's like we are still winding back to possibly 2 decades ago in practice.
Yes.
So now, how do we go by? The question now is, how do we bridge the gap, just like the title of this conference for the year? How do we bridge the gap in transforming the lives of these children by virtue of the modern research and those that will be done in the future, so that people in the classrooms, teachers and some of us that are still students, can now contribute positively to what is going on in the world, especially in seeing to the resolution of autism problem?
Okay, I'm going to have someone else take this. Dr.
Fayemi, I can't say I listened to the question with the view of answering, but some things occurred to me when you were saying these things. You will always find research from more advanced areas. There's always going to be. There are going to be people ahead of you, and as you found also today, there are people that are still wanting to be where we are in Nigeria today. The thing is that when we hear those things, we have to think as indigents of this country, how does that apply to us? How can we customize it to our reality here? I don't want you to throw up your hands and say, oh, that's over there. You know, because if they can do it, then there's a version of it can be done here. And it's very ripe for research to adapt what you found over there, what you found, the knowledge is knowledge creation. And that's why I was telling somebody today who approached me and said they are in a PhD program and that they're using, it's a university in London, online, but they're using information from here for their dissertation. I said, that's good, that's knowledge creation. The person in London, you better believe, is actually interested in finding out what the findings will be, because that's new knowledge for them too. So you should always create knowledge, and don't think that it's, the worst thing we can do is throw up our hands and say it's only there in the US that they do that. Or say, oh, these people don't know what's going on here. Listen to what they're saying and see how we can use that in Nigeria, in the Nigerian situation, the Nigerian factor, because we know more than anybody else. Thank you.
Thank you. Did that kind of answer?
Yeah,
Yes,
one last-
but you know, we still need to write up what we have and try to present the information. And with all research and with all methodology, we still have to look at each thing and see what works. You know, because what might work in the United States may not work here. And that's why we need more information from here to add to the literature to show that, wait a minute, we are having this thing in here and we find that this is working. One of the biggest things that I've discovered here, and this is anecdotal, is that the awareness is increasing. That is, there's evidence to show that. But I do not know if we have anything written up anywhere where that is to show. We know when we started 5 years ago at a little hotel, Weston in Ikeja, Westtown in Ikoyi. Ikeja, I said it right at first. And we had just a room, just maybe half of the middle here, where all the participants were. And they were there. You could see the strain on their faces. You could see the hope after we were finished, to have captured that. And that first conference is on YouTube to see what we did. And I think when I do come back, I hope that I'll do some more of the workshops for the teachers, because I thought that went over well, and I think it's about time. We have new people, so I can still do some again for that. But we need that. We need to have that. Then we moved up and we moved here, and this morning when I came in and I saw that there was no empty chairs.
Dr. Sonia,
That's awareness.
Dr. Sonia, we have one last question for you over here.
My question is a follow-up to the first speaker.
Okay.
I'm wondering if Gtbank would like to take up the initiative on the research and data collection for the autism in Nigeria, so that can add to the good initiative on this program. I mean, make this program a better initiative, and rather than making it an annual seminar, and at the end of the day, we don't have any report or data collection on autism in Nigeria.
Well, someone from Gtbank.
Okay, we'll take your details and we'll consider that offer.
And I'll be part of that research team.
Thank you very much. Thank you very. Thank you very much. So this brings us to the close of the conference for today.
I'd like to just give a vote of thanks to everybody for being a part of this day with us today. Thank you very much to all our speakers, and thank you very much to all of you guys as well. We're really pleased to have you. Today has been absolutely successful. I've learned a lot, and I'm really looking forward to tomorrow. So just to quickly take you through what you can expect on day 2 of this conference. So we're going to be starting tomorrow morning at 9 o'clock. We have 8 o'clock in the brochure, between 8 and 9 o'clock for arrival, registration, and so on and so forth. But the actual program will start at 9 o'clock, prompt. And pretty much that's it. Have a safe journey home. We'll see you tomorrow. Please do make sure you look around. Make sure you haven't left anything behind. We wish you a safe journey, and we'll see you tomorrow. Thank you, everybody.